Kill him. Check the second mic, check the second mic.
Good morning, ladies and gentlemen. You are welcome to the inaugural edition of the Africa's Nutrition. We will be starting very soon in the next one. Very insightful, very informative. So just settle down, and in the next 5 minutes,
can't be from here.
Check, check, check. Check, check. Check, check. Check, check.
Oh, guys, phone that microphone is now.
Obviously, you know that the microphone is speaking this thing. It's speaking the signal.
But it's somehow outside because it feels.
That's. You can see.
Okay, okay.
Yeah. Okay.
Couldn't fight it. I had hoped you'd see my face and that you'd be reminded that for me it isn't over. Never mind, I'll find someone like you. sometimes it hurts instead. You know how the time flies on me. Yesterday was the time of our lives. We were born and raised in a summer haze, bound by the surprise of our glory days. I hate to turn up out of the blue uninvited, but I couldn't stay away. I couldn't fight it. I had hoped you'd see my face and that you'd be reminded that for me it isn't over. Never mind, I'll find someone like you. I wish nothing but the best for you too. Don't forget me, I think I remember you saying sometimes it lasts in love, but sometimes it hurts instead. Nothing compares, no worries or cares, regrets and mistakes, their memories made. Who would have known how bittersweet this would taste? Never mind, I'll find someone like you. I wish nothing but the best for you. Don't forget me, I beg. I remember you say sometimes it lasts in love. I wish nothing but the best.
More music on trendybeats.com.
Good morning, ladies and gentlemen. Good morning. Greet me now. I know we are starting late, and for that we sincerely apologize. We're going to make sure that everything runs as smoothly as possible. So good morning, ladies and gentlemen. Thank you very much. If we're at the back, please can we make our way forward so that we fill up the seats? Thank you. If we're at the back, please can we come forward so that we fill up the seats in front? Thank you. God bless you as you comply. All right. Thank you all so much. You are to Africa's Nutrition and Health Summit. If you're excited to be here, can I get a round of applause, please? Today is going to be absolutely informative, educative, insightful, powering, and so much more. Every feeling, every good feeling you can get, you're going to get it at this event. Take my word for it. This is the inaugural edition, and just before we commence, because we are all children of God, we would like to commit this event and ourselves into the hands of God. So we will start with the opening prayer, and for that I would like to call up on stage the National Director of National Issues and Social Welfare of the Christian Association of Nigeria, who will be representing the president of CAN, of the Christian Association of Nigeria. That's the in-person of Archbishop Daniel Oko. So ladies and gentlemen, please welcome Commodore Abimbola Ayuba as he takes the opening prayer. Thank you so much, sir, for being here with us today. Thank you very much, sir.
Shall we pray? Heavenly Father, we thank you. We glorify your name. The one who was, is, and will continue to be. Father, as we gather here today in our numbers, we commit this program into your hands. Mighty Lord, I pray that you fill every participant here with the deep intuition, wisdom, and understanding that we have to trust this new initiative into a very glorious venture for Africa and Nigeria in particular. Lord, may your name be glorified. As we continue in this particular room, Father, continue with us, bless us, protect us, save us from any unexpected accident, save us from any unexpected ill news. Father, we cover everyone here with the blood of Jesus. Thank you, Father, Lord, for answered prayers. We return glory and honor to you. For in Jesus' mighty name we have prayed. Amen. Praise the Lord.
Thank you very much, sir. I think he deserves a round of applause. That was a very powerful prayer. Once again, Commodore Abimbola Ayuba, RTD, the National Director of National Issues and Social Welfare at the Christian Association of Nigeria. Thank you, sir. Thank you so much. We have committed this event into the hands of God, but we need to always remember that we are Nigerians. We are Nigerians at heart, our fatherland. This is our fatherland. No matter how we might complain, we are first sons of God, daughters of God, and then Nigerians. So please, can we all rise as we take the national anthem? I would like to call up Favor with her very sonorous voice to take us the national anthem. Thank you, Favor. I think she deserves a round of applause.
Our own dear native land, tribe and tongue may differ, in brotherhood we stand. Nigerians all are proud to serve a sovereign motherland. Our flag shall be a symbol.
Today is about wellness. Today is about wellness. Today is about nutrition. Allow me to once again and officially welcome you to the inaugural edition of Africa's Nutrition and Health Summit. If you're excited to be here one more time, can I get a round of applause? Indeed, today is going to be absolutely amazing. Now, if you're wondering what ANHS is all about, just a brief overview of who we are. So Africa's Nutrition and Health Summit is a Pan-African event that you are here and witnessing today, aimed at promoting a healthier and vibrant Africa through sustainable nutrition and healthy practices. Now, this summit will focus on raising awareness about preventive health care, leveraging modern technologies, sharing evidence-based insights on preventing non-communicable diseases, which unfortunately have been on the rise, not just in Nigeria, not just in Africa, but globally. So we're going to be here just looking at how we can bring Africans closer to having better health through their nutrition, through their lifestyle changes, and so much more, even exercises. And I promise that today is packed with so many panel sessions, activities, exercise, because we practice what we preach. So just get ready. You're going to jiggle some bones that you probably haven't in a while. I promise you that. Today is going to be all about the stakeholders in all these different industries that make up the food, wellness, and health, sector will be here today. So leverage on that to network. We have amazing speakers, our keynote speakers, our panelists that are here with a wealth of understanding, wealth of wisdom to share and, help us. We have food bloggers. We have even the Ministry of Agriculture. Please, I would like us to just give a round of applause for our representatives from the Ministry of Agriculture. Thank you for being here today. Thank you so much, sir. We see you. Thank you. All right, just so that we have an understanding, non-communicable diseases, which I mentioned earlier, are diseases like cancer, diabetes, heart diseases, which have been on the rise. I mean, I was scrolling through YouTube, and it was just a very random video about how dogs can smell if there is cancer. Now, it was a video where a neighbor had been complaining to her other neighbor, like, why is your dog always coming to my house and licking my body? And the neighbor was like, have you gone to check your health? Dogs can smell and sense. And I was quite baffled because I was seeing, oh, I remember when I discovered I had cancer. Oh, I had this cancer. I had this cancer. And I'm talking about a comment section. Had cancer, have cancer, were experiencing or going through. Like I said, all these non-communicable diseases represent, or they are responsible for 7 out of 10 deaths globally. And I feel like that's such a big number. Don't we agree? 7 out of 10 deaths is such a big number. And that is why we're here today. That is why ANHS has brought this beautiful summit here. So we talk to our practitioners and we know what we can do and how to help Africa as a whole combat this epidemic. My name is Pelumi Buari. I will be your host. I think I deserve a round of applause, don't you think? Thank you all so much. For that, we say thank you for creating time to be here today. All right. You know how I said we're going to exercise, so get ready. If you need to breathe in and breathe out, you need to do that. But before we start our exercise, we have a very short video.
According to the World Health Organization, of the 38 million deaths caused by non-communicable diseases in Africa in 2012, 16 million or 42% were premature and preventable, compared to 14.6 million in the year 2000. On the continent, the Africa Centers for Disease Control and Prevention, a specialized public health agency of the African Union, intends to play its part in reducing the spread of these diseases.
Africa CDC is committed, every country, each and every partner, so that we see this strategy not only being implemented, but being implemented efficiently and to the benefit of this continent. We really
caused by non-communicable diseases in Africa in 2012, 16 million or 42% were premature and preventable, compared to 14.6 million in the year 2000. On the continent, the Africa Centers for Disease Control and Prevention, a specialized public health agency of the African Union, intends to play its part in reducing the spread of these diseases.
Africa CDC is committed 200% to ensuring that what we are agreeing on today, what we are launching today, is going to be implemented to the best of our resources and abilities. We shall work with each and every country, each and every partner, so that we see this strategy not only being implemented, but being implemented efficiently and to the benefit of this continent. We really must show
the health agenda of African countries and of the members of the African Union is gradually converging towards the reduction of non-communicable diseases and mental health problems, which have been at the heart of the consent of states for decades. Actions are on the way to deal with these pathologies, as well as the problem of injuries caused by natural disasters and conflicts, among others, a difficulty accentuated by the disruption caused by the COVID-19 pandemic.
We started the most complex and challenging period of implementation of this strategy over the coming 5 years. And I believe that we need many meetings, our ideas, discussing the difficulties and challenges.
We are decentralizing diabetes and hypertension screening and management.
All actors within the Africa Centers for Disease Control and Prevention and the African Union Advisory Group are reassured that their efforts are appreciated for what is being done. Also, Africa CDC intends to do much more, and the implementation of the strategy is on the way.
This way, follow me. Follow me. Turn this way, follow me. Follow me. 10, 9, 8, 7, 6, 5. Other side. 10, 9, 8, 7, 6, 5, 4, 3, 2. Let's go. Spread it out. 3. Let's go. That is 10. Okay. Close the leg a little bit. Look at me. Lift up. Bring it down. 1, 2, 3, 4, 5, 6, 7, 8, 9. Up. Hold it. Hold it. Hold it. Yeah. 10, 9, 8, 7, 6, 5, 4, 3, 2. That's 1. Cross the legs like this. Gently, 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 gently. Take this way. Take it down. 10, 9, 8, 7, 6, 5, 4, 3, 2. That's 1. Cross again. Other side. 10, 9, 8, 7, 6, 5, 4, 3, 2. That's 1. Your neck. 10, 9, 8, 7, 6, 5, 4, 3, 2. Up and down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Your right hand. Take it up. 1, 2, 3, 4, 5. That's 6, 7, 8, 9. Other side. 1, 2, 3, 4, 5. That's 6, 7, 8, 9. That's 10. Spread your hand. Take it down slowly. Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right. 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's go. 2, 6, 7, 8, 9. Last 10. 10, 9, 8, 7, 6, 5, 4, 3, 2. Thank you, thank you, thank you, thank you, thank you, thank you.
For that, Coach Obi. One more time, a round of applause. How do we feel? How do we feel? Refreshed. You know, I was just hearing crack, crack, crack. I said, wow, bones are cracking. We are stretching. I feel good. I feel like I've gone to our theme. Soil to wellness. Oh, wow, that's me on the screen. Hallelujah. Amen. Okay. So like I said, soil to wellness, shaping a unified approach to Africa's health. And that's why I said it's a unified approach. So that's why I said we're all partners. So commencing our first panel session, we're going to be talking on, it's the healthcare panel. If you're excited, can I see your hands in the air? If you're excited about our healthcare panel, we will be talking about bridging the gap, integrative approaches to preventive health care in Africa. And I promise you that our lineup, our speakers for today are absolutely amazing. When I read their bios, you'll see what I'm talking about, because they have Their bios are they are heavy. There's no other word for it. Okay. First of all, I would like to call our first speaker. Now, she is a distinguished CMD and co-founder of Upline Health Group, comprising of Lagos State's executive cardiovascular centers, Chiron Hospitals, ICU and Surgical Center, Upline Pharmaceuticals, Kano Cardiac and Renal Center, and Klein Health. Now, she brings over 35 years of expertise as an attending adult cardiologist. Her unwavering commitment lies in the early detection, education, and prevention of heart, vascular, and thoracic diseases in Nigeria. She is a trailblazer and author of several impactful review papers. Her work addresses the specific burden of cardiovascular diseases among Africans. Notably, she has been recognized severally for her work with the numerous awards, a testament to her exceptional contributions to healthcare. She has consistently elevated the standards of cardiac care in Nigeria as a founding member of the society. Her influence extends globally, internationally recognized. She holds memberships in prestigious organizations such as the European Society of Cardiology, American College of Cardiology, and the American Association of Black Cardiologists, where she actively leads various working groups. She continues to shape the landscape of cardiology, championing health disparities, prevention, and providing visionary leadership advocacy in cardiovascular medicine, federation, advocacy groups, both in Nigeria and globally, championing heart health awareness campaigns. She is currently the leading advocate for heart diseases in Nigeria and globally. Ladies and gentlemen, please can we welcome Dr. Folashade Ali. Thank you. Please come on stage. Thank you so much for being here today. Thank you. Please let's ensure we clap till she makes her way. Over 35 years of experience. That's absolutely mind-blowing. Thank you so much for all that you've done and all that you're doing. Thank you. Site Nigeria. How can we promote early detection and effective management of endocrine-related non-communicable diseases in primary care, given the high cost?
Thank you. First, let me join my colleague. By the way, Shadia and I were classmates in Ibadan.
Wow.
So I'm very glad to see her. We graduated the same year we are in the same cohort, the same set.
Wow.
So let me also join her to encourage you. I always say that a tree may not make a forest, but it does.
Thank you.
Do not be discouraged. I've organized things like this over and over. In fact, part of my life and history is to have organized things like this, so I know what it takes. In year 2017, I published during my inaugural lecture. I had my inaugural lecture in November 2017 at the University of Lagos. I posited 21 different items for good health, generally worldwide. One of the things, I think either number 20 or 21, is early detection. Either number 1 or 2 is knowledge. Very often in our environment, in fact, we say it clearly that what you do not know does not kill you. How many of us have heard that phrase?
Ignorance is bliss.
But it's not true. In fact, what you don't know kills you very often. In fact, it will kill you over and over. We are here. You size movement. But in our little domain here, we are so a little bit. We don't even mind anyway if the car will enter the house and drop us inside. We have become that sedentary, you know. And what have I done in my own office? I hold several meetings throughout the day, standing, you know, walking around my office. So you can do that too. Exercise is still the cheapest preventive medicine. It's all around the world. Number 2 is our food. You know, like Shadia said, very often these days, you put a loaf of bread on your table, and you are so happy that, a week after the bread is still good. Right? You are so happy. But it's not true. You have to go beyond talking. We need to invest more in action. We need to involve more the implementers of policies. So it's a lot of things. And I'm going to advocate again that the discussion here can never end today. You should create other platforms whereby this discussion continues. It's a continuum. It can never end. Maybe to the end of the world. We will continue to advocate and advocate. Many of our people, health is wealth. If you talk about technological development, there can never be any technological development in the absence of good health for its people. It is the primary aim of governance. When I go to National Institute of Policy and Strategic Studies, some people were mentioning good governance. I said, for me, there is nothing like good governance. It's a tautology. What is governance? Governance is governance. Governance is either there or governance is not there, for God's sake. So part of the governance is to ensure that your people are in perfect health. Not just good health, they are in perfect health. And the health is accessible, not only to the few. So we need some of the regulations that come out of Nigeria. It said, no, if look that I was once the CMD, cannot take care of him, so be it, let me die there. He refused. We need more people like that. On that note, I will stop for a while. Thank you.
Thank you very much. Thank you very much. Thank you very much, sir, for, in fact, I feel like you've answered quite almost all the questions we had for you, you know, in that one question, but thank you very much. So we've talked about the future, we've talked about where we're headed as Africans, and quite honestly, I'm scared, but even the fear is not, oh no, it's more of what can we do to change. So thankfully, that's why we're all here, and I'm sure every single person here has that question as well. What can we do to reduce what we are seeing ahead? And part of me is also questioning that if they're seeing everything as, oh, Africa, Nigeria, I wonder what edge we have as Africans. Because, you know, there was, during COVID, for example, there were a lot of back and forths on maybe Nigerians are we being able to combat bacteria, like we were able to fight the diseases. That's why COVID did not spread as much. I mean, we saw different myths, we saw different stories flying around. But so I would like to know what edge we have as Africans to combat these. And I don't know if Dr. Ndifon will be able to answer this question. Our virtual panelist. Tech, can we bring her on board? Is it on? Hi, Dr. Ndifon. Can you hear us? Can you answer? Hello? What's going on? Okay. AI. I can't wait for AI. All these will be avoided with AI. Okay, so while they're trying to ensure that works, I'll just direct the question to you. Okay, please unmute your mic, Dr. Ndifon, if you can hear us. All right, so while we're trying to get that sorted, Dr. Ali, talking about the edge that we Africans have, or the advantage that we have, I mean...
Hi, Dr. Paul.
Hello? All right, so just asking about...
Hello!
Finally!
Is it good morning there? Because here is good afternoon.
Good morning. It's still morning over here. Finally!
Hello.
We can hear you. Can you hear us? Can you hear us?
Can you hear me?
We can hear you loud and clear. Can you hear us? Okay, while I'm trying to ensure that works, I'll just direct the question to you. All right. I think we'll just put that on hold for now so that we can just, because this is taking a bit more of our time than we envisioned. All right, so Dr. Ali, talking about the advantage that we have as Nigerians, just like Professor, Prof said about our local herbs, plants, and all of that, but even in terms of how, like, lifestyle changes, we're looking to the future now, what we can do now. I mean, I'm in my 30s, and quite honestly, when I climb the staircase, I'm panting. I'm like, when I'm 50, what's going to happen? So, looking to the future and preventing all of this in terms of what advantage we have that we can maximize, and how, in terms of lifestyle change, nutrition, and so much more, that we can prevent these statistics that we are seeing here today.
Okay, thank you very much, Mr. Moderator. I think your questions are in two. You first ask what are the, although you want the NCD, the lady to answer, yes. What were our advantage or our advantages why we were not dropping, dead, on the road, because it was like the WHO, the Western world, were thinking during COVID, Africans will just be dropping, just be picking dead bodies. But I think our God that we serve came to our rescue. That's number one. Then number two, I believe that because of the, continuous infections, the communicable diseases that we have, even the malaria, tuberculosis, all these communicable diseases that are pretty much with us, they are able to kind of elevate our immunity such that whenever even another attack comes, we are able to mount some resistance to. So, but I think the nature, what we had in Africa, or still having, that saved us during the days of COVID, were our resistance in terms of continuous, infections, that is available in Africa. So with that, we're able to call up our memory cells, our immunity to this newer agent. In this whole wide world, nothing is really pretty new, because, it's
community health workers, and then engage them, that will help us to reduce non-communicable diseases.
Yes, I mean, you've said so much, and I think you've taught us ways in which we never even thought on how we can reach, these communities, because in as much as sometimes I feel like because we're in Lagos, or because we travel a lot of times, we tend to forget that there are certain communities in deep in the west, in the north, in the east, in the south, who have no form of access to the things that we take for granted and the things that, are primary sources of information, which most station at your hand. Thank you very much, Dr. Ndifon, for, giving us different ways to reach these people. And, Dr. Amos, we're coming to you, our nutritionist on this panel. We've talked about preventive ways, reaching people, what to do in the future. Hi, Dr. Kamal. Thank you for being here with us. As a nutritionist, we would like to hear your take, because quite honestly, and I want to say that I'm well exposed, I don't know so many people that enlist the help of a nutritionist, quite honestly. Do you agree with me? Our own is just, okay, we ate eba in the morning, we have to eat rice in the afternoon, okay, we eat spaghetti next tomorrow. That's how we calculate our nutrition, that we don't want to eat too much of something. And most times when you ask people why they don't have a nutritionist, they say the cost of getting a nutritionist. So can you tell us how, the average man, I'm the average man to be honest, how the average man can get access to nutritionists to better guide their diets? And, also just tell us, the innovations in food science or nutrition that are emerging that could support the prevention of non-communicable diseases. So I've basically asked you 2 questions, and we would like you to, answer as quickly as you can, because I know that our guests here have questions for every single, panelist. So please, 2 questions. The floor is yours. Oh, well, the internet space is yours.
All right. Thank you so much. And I'm so glad, I hope everybody can hear me. I'm so glad to be part of this panel session, and I'm so glad to be joining you live from Nairobi, Kenya, just East Africa.
Thank you for being here.
Yes, and I want to confirm that the same challenge that exists in Nigeria in terms of our acceptance for the role of a nutritionist in healthcare is the same. I would call it a problem that runs across different continents, and specifically Africa as we speak. Rarely will you find an African looking for someone who can tell him or her what to eat, when to eat it and how to eat it. It's so rare. We have grown to, these are professions that has not been recognized in its entire capacity. It's so profound, it's so essential that their ignorance, there's a statement that I use, that the silence of a nutritionist is a cost a society cannot be able to afford. And I try to attribute the rise of
Hi, Dr.
Recording
Amos.
stopped.
Hello, Dr. Amos. All right, the network.
Recording in progress.
We had someone raise up her hand or to ask a question. Okay. So you can tell us your name and ask your question.
We're going on. One is that I will encourage everyone, especially who want some knowledge on some of our herbs, of our plants here that are good, to go on YouTube. You can watch my inaugural lecture. At least I worked on over 50 herbs, 50 native plants. But I make bold to say that you can as well call me a herbalist. Unified name, herbologist, for somebody who has worked extensively on herbs, even though I'm a medical doctor. So you can just Google Abraham Oshinobi inaugural lecture. They are all there. Let me also say again that underscore the import of what we are here to do. There are 3 things that can cause disease. Now, plastics are being taxed enormously. You know, eventually those plastics that he use, because it's very easy to be produced, lab, eventually they get back at us. You know, I just came back from a conference now. Throughout that conference, they were wrapping moi in nylon. They were wrapping swallows in nylon. I had to call. It took me time to sit the managers down, to educate them. It is causative. That is, plastics cause cancer, period. It's not that we are associating anymore. We have now confirmed it because of two basic agents. Then the last thing is that we can leverage on technology, just like
like you said.
We can actually. So collaboration is between, the collaboration starts with us, with individuals. It extends beyond the functional attendance, especially in a lot of, I just came back from an outreach in Plateau State. You will be shocked. We learned that when there's a particular village we went, we learned that when those kids, the female, are kept out of school, once they are menstruating, it's not because of the tradition, not because they could not afford sanitary towels. We were shocked. So we just said, look, this one is more than, we need to do more and more. So we need to do what I call culturally adaptable outreach, education. And so we may also we should actually involve grassroots. I will give you an example before I round up. Recently, we learned that an outreach established, a government established boreholes for people nearby. Yeah. But they refuse to use the borehole. Do you know why? They prefer the boreholes very far, the stream very far, because most of them live in one-room apartment. It is during the time they send the children out, that is when husband and wife usually see themselves. So they just refuse. So when you don't understand the cultural dynamics, you just give what the society actually does not need. So it is important that we involve every stakeholder. Thank you.
Thank you very much for that. I think they all deserve a round of applause. That has been... Did we enjoy that panel session? We learned... I've been seeing people... I can't even imagine what, would happen by the time we're through with all our panel sessions today. So one more time, thank you so much, Dr. Ndifon. Thank you so much, Dr. Ali. Thank you so much, Professor Shinobi. Thank you so much, nutritionist Amos. You have all been amazing. As they rise, I would like to call the convener of the Africa's Nutrition and Health Summit, Dr. Jesukwelumi Adenihu, on stage. I think she deserves a round of applause for such a beautiful dream that she has brought to light. And as she comes, I would like our panelists to rise so that we can take pictures together. Thank you all so much for being here, creating time. This has been absolutely amazing. I have learned so much beyond even what I thought I would learn. Thank you. Hi, JP. Virtual? Well, please just pose. We will take screenshots. Thank you very much. One more time for Dr. Ali, Dr. Professor Shinobi. I mean, it's such a surreal moment. Yes, you can. Seeing your classmates, you all thriving and excelling together years from now. I can't wait to see mine as well. That's beautiful. Thank you so much. Thank you for that shout. I'm honestly overwhelmed and blown away. And while they were talking about stakeholders, partners, and just everybody in the health and agricultural sector, when she also talked about drainage, I just realized that every single person plays a part in ensuring that our future is safe. We talked about drainage, we talked about flooding. What is causing the flooding? What is causing the blockage of drainages? Where you're eating in traffic and you decide to wind down and close, you are causing more harm in our future than good. And you know, when she kept talking, I have a background in architecture. I have my master's in architecture, even though I'm holding a mic to talk. That there is some form of proper ventilation in the houses, and we're creating drainages that last long, not drainages that we do 1 year, we commission. After 2 years, it has blocked. We don't need that. We need sustainable year. So this has been absolutely mind-blowing, and I have to say once again, thank you all so much to our panelists for being here and, you know, just broadening our minds on the things that we can look forward to. All right, I would like to, our next speaker is ready for us. He's joining us to combat non-communicable diseases in Africa. Now, just to enlighten us on another powerhouse that we have brought here today who's speaking here, he is the strategy and investment consultant. So he is the founder and CEO of Dr. Andreas Bluthner, and it's a strategy and a network of global experts, including across Africa, with a passionate commitment to innovation, sustainability. At the core of his strategic vision is a profound dedication to developing ingredients, formulating nutrient-dense foods, and fostering sustainable local food production and food systems. His strategic focus on innovation and partnerships has catalyzed systems, school feeding, reduction and avoidance of food waste, infants and the young child, and RUSF. It's quite long. We're still introducing you. Now, he has a PhD in international law and taught and mentored. Are we doing that? All right. So please help me. I do need you. Thank you. Exercise. So we know what we're doing, right? So a round of applause. Please come. That's just level 1. Please, that's just level 1. If you think you got it, a round of applause. If you did not get it, still a round of applause for yourselves. It's something that we can always imbibe and practice on. That was stage 1. Stage 2, I need you to do this. 2 and 1. 2 and 1. Now, I need 1, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Report yourselves. Did you get it? Report yourselves. Did you get it? I saw some people giving the middle finger, but it's all right. We accept it either way. Thank you so much. A round of applause for yourselves. Thank you so much for indulging me. They said things like that help with your cognitive function. So because there's a level of concentration that goes into it. So thank you all so much once again for indulging me. I would like to call up our representative from the Ministry of Agriculture in the presence of Mr. Aina to just quickly come talk to us and just, comment on the Ministry of Agriculture's activities, at the intersection of nutrition and health, because that is why we're here. Please give a round of applause to Mr. Aina from the Ministry of Agriculture. Thank you for being here today. We are truly grateful.
Thank you for having me. Good afternoon, all. My name is Toby Aina. I'm a director in Lagos State Ministry of Agriculture and Food Systems. I'm here to just give you a brief synopsis of what we've been doing. And first of all, let me give kudos to the organizers of this summit. This is a good summit that can awaken the sleepiness in us, because we are what we eat. So it's about time we get that into our consciousness. Thank you very much. First, let me give kudos again to His Excellency, the Governor of Lagos State, in the presence of Mr. Babajide Sanwo-Olu. He's a forward thinker and is an upwardly mobile person. And he kind of challenged all ministries to come up with new innovations to move their ministries forward. So by virtue of this, my Honorable Commissioner for Agriculture and Food Systems, in the presence of Mrs. Abisola Olusoya, with the commission of my permanent secretary, Mr. Emmanuel Audu, came up with this agrithon. You could have read in the news some few days back, about 26 people, upstarts, we call them agripreneurs, were given 100 million naira to share among themselves to bring up innovations in food production. We have about 316 entrants, but 26 finalists finally came up and they were given 100 million naira to share, to come up with innovations on food systems, how to improve right from production up to where we are consuming on our table. Because we discovered that so many times we produce a lot, but about 70% of what we produce go to waste in terms of packaging, transportation, and things like that. So part of this, some few months back, Lagos State government started a food hub. We had a pilot program in Mushin Idioro where you can buy farm fresh foods, well packaged and well handled, with no hindrances whatsoever. So we are planning to build many more in many local governments in Lagos State so that every Lagosian can have access to farm fresh foods. So, thank you. In respect of there are so many other things going on in the Ministry of Agriculture. If I should go on, we'll take the whole day. Because we discovered that we did so many researches and we discovered that so many problems lie. Even at home, food is being poorly handled. Unfortunately, I lost my mom to something like that. She died of, what do you call this thing? Lung carcinoma. Because she was too addicted to microwave. About some 14 years ago, I came across a research that microwave is carcinogenic. I told her, but you know our old people, very, very stubborn to what they believe. I told her we better get a ceramic plate that is adequate for microwave use. It's very scarce in Nigeria. You can see people just putting lots of plastic into the microwave to microwave their food. That's the cause of carcinoma in many Lagosians. Many people are dying of cancer. They are not originally cancerous from their family, but because of the way they handle the food they eat, they got cancer. That was what killed my mom last year. So please, I want us to be very careful in the way we handle our foods. Government is trying its own to make sure there is nutrition and good food. Because right now, I can tell you that 70% of soils in Lagos State is acidic by virtue of effluence from companies and factories like that. So this is what we are trying to guide against. And a summit like this is more or less an eye-opener to many people to be very, very conversant and be careful of whatever they put into their tummy. Thank you very much.
Thank you so much for that very short but enlightening speech. We're glad that Lagos State is taking the initiative to, foster initiatives like this and movements like this, empowering, because a country or a nation is only as strong as its empowered people. So we're glad and we're grateful that that is happening. Thank you so much. Please ensure that you relay our gratitude to the Governor of Lagos State and of course to the Minister for Agriculture. Thank you very much. Okay, so we're going to our next panel session. And we have an array of
different topics that we're shedding light on today. We've had the healthcare panel, we have a tech panel, we have an agricultural panel, we have a policies panel, those that are in charge of policy making. You know, we have a panel just so that, you know, you have access. When I said all the stakeholders are here today, I did not mince. Even though we're little, or I mean we're few, we can, you know, network, collaborate. I'm sure that so many collaborations will begin from this room. And when we see them in broad daylight, when we see them, you know, achieve their goals, though I should have done this earlier, I want to see, I'm a host. Hi, my name is, just introduce yourself. It's so funny how even in places like church, you don't know who you're seated next to. Even in places like church, you don't know who you're seated next to. You can be seated next to the answer to your prayer. The person you're looking to get a grant from could be seated next to you, and you will never know unless you introduce yourself. So I'm just going to give us 30 seconds to just elevator pitch yourself. My name is, just introduce, I can see, thank you very much for indulging me. I can see him turning to the back. Thank you very much. Please introduce yourselves. All right, I want to believe we've done that. If you exchange numbers, fantastic. Once I leave this stage, I know the people I'm targeting. I will just head on straight. But I have to do my work first. All right. Quickly, before the panel session, quite honestly, today is just a good day, to be honest. Today is really just a good day. We have such an intergenerational panel, an intergenerational speakers. We have those that are young and the younger ones. We don't do old, sorry. No one is old here. You're either young or younger. You're either Gen Z or the generation before. We don't care. We don't care about any other one. All right, I would like to bring up someone who's amazing, and I'm looking forward to hearing her speak. She is, when we talk about tech, we're talking about artificial intelligence as well. And quite honestly, AI can be applied to basically anything in life. And when we're talking about agriculture, we're talking about the future, we're talking about how we're evolving and what we're evolving into. We need to consider AI. We need to consider how technology can make it easier and better for us. So we have someone, an amazing lady, who is the chairwoman for AI for Africa Empowerment Foundation. Now, she is the president of King's Arc Global. She provides strategic AI coaching to executives and teams of small, medium, and large corporations. Now, since being enrolled in the Artificial Intelligence for Business and at the University of Oxford, United Kingdom, she has presented AI awareness to over 7,000 people, including women in management, business, and public services, WIMBIS, Nigerian Bar Association, Otuocha, Faculty of Law at Nnamdi Azikiwe University, World Congress on Innovation and Technology, Business School Netherlands, Global Alumni, National Institute for Credit Administration, Secretariat for Women Affairs, FCT Abuja, Center for Public Service Productivity and Development, Tribe Africa, She Forum, and so much more. Now, her mission is to create artificial intelligence awareness training and technology hubs for empowerment in building stronger, more economically vibrant communities through partnerships and collaborations with governments, governmental organizations, private organizations, professional entities, and foundations. Ladies and gentlemen, please help me welcome Letitia Bertrand. Thank you so much for being here. We are so glad to have you. You look amazing. Thank you. So quickly, she'll be giving a quick, brief speech on AI, food, nutrition. This is why we're here, Africa's Nutrition and Health Summit. Thank you.
Thank you so much, Benjamin. Good afternoon, ladies and gentlemen. It is wonderful to be here. My name is Letitia Bertrand. I'm chairwoman for AI for Africa Empowerment Foundation, also president of King's Arch Global. So my mission is to get AI just at everybody's doorstep, to have you to understand the basic tenets of artificial intelligence. Because guess what? It's taking over. Every aspect of our lives will be affected by artificial intelligence. I'd already retired. I'd been about 30 years or more in the United States, and I came back here to retire. When I came back to Lagos, I realized I couldn't retire. There is a lot of work to be done, and that's why I say big kudos to Dr. JP. She's outside. Can you bring Dr. JP in here for us, please? When I was in Lagos, and immediately we just got along. And I told her that I was going to support her because of her genuine interest in Nigeria. A lot of doctors would have jackpot, left, gone somewhere else, and no offense to those that are out. But to those who are here and stay committed to Nigeria, I will support them wholly. That's why today is supposed to be my nephew's wedding, but I decided to be here to give my support. I'm telling you, food is a factor. For us as a nation, we love to celebrate. What do we celebrate with? Food. But if we don't eat the right food, if we don't eat them in the right order, what's going to happen? Negative things, diseases, our lives are caught shut. God forbid. So now with summits like this, we have knowledge, we have awareness to help us live longer. So I hope you're ready. Because in addition with this knowledge, there's knowledge about artificial intelligence, which I have about maybe 7 more minutes to impact to you. With artificial intelligence, there is technology to help us to live longer. What do I mean by that? Artificial intelligence, basically, to explain what it means, is human beings using algorithms or basically mathematical equations to teach machines how to behave, think, process information, and make decisions like human beings. That's the basic definition of artificial intelligence. Using machine learning to train machines to learn what we do so that they can help us live better lives. I know a lot of people say that with the advancement of artificial intelligence, more jobs will be lost. And I tell you that even if, let's say, there are 600,000 jobs created as a result of artificial intelligence, so there will be new positions. That relationship between artificial intelligence and food and health. Well, just as I explained earlier, that we train machines to behave like human beings, but more exponentially, they can make decisions for us. And they're getting smarter and smarter and smarter. At some point, will they be smarter than human beings? Human beings. Okay, so that is a subject of maybe a lot of people don't understand. So let's talk about quantum computing, for instance. If you've learned about quantum computing or you've heard about quantum computing, you know it's an exponentially advanced machines will start becoming right now for you. You open your refrigerator and there's all kinds of things in there. How do you assemble your celery intelligence apps You just take your phone, take a picture, plug it, healthy meal. So I'm currently at the University of Oxford getting more information about artificial intelligence. So in some of my summits that I've attended on AI, we have learned that can monitor like your blood pressure. So let's say, for instance, if somebody has in them, will immediately detect maybe the increase in the blood sugar and send it to their wristwatch or to their telephone so that they can step back and reconsider what they're eating. And also, there are wearable devices now that allow, actually no, let me put it another way. There is AI technology that can allow one's experiences to be transferred from one's brain to another person's brain. That is super amazing, isn't it? So one of the panelists earlier was talking about trying to get the message. Here today, I wanted to be able to reach every single person in the room, from the doctors in the room to the people in communications in the back, to those that are serving, everybody, so that they can understand the message. And I hope that that message is clear today. So short message, but I hope that it is once again, and thank you so much for your time. Thank you. Can I give you a hug? Yeah.
Thank you. Thank you so much, Dr. Letitia Byrne. Sorry, I said, I'm surrounded by so many doctors. Thank you very much, Letitia. That was amazing. You make AI sound so sweet. You make it sound so simple as well, but it's not. Letitia Bertrand. Okay. Say we're getting there. Say we're getting there. We're getting there. We have so many more things in stock. But I feel like you've been sitting down for too long. I think so, right? Hoping that you'd be able to stand and stretch to go get refreshments. But then we're like, oh, you're kings and queens. Let's serve you. But we still need to do that exercise. Coach Obi from Fitness Plus. Please, one more time, welcome Coach Obi from Fitness Plus to take us on little exercise because we need to stretch. We've been sitting down for hours.
Good afternoon. I really appreciate everyone for being present. And I also thank all the doctors for their speech because they just give me revision of what I learned when I was doing my healthcare assistant a few time ago. So I really had, and at the same time, I've learned a lot. So thank you once again. God bless you. I'm wearing this shoe with pin. Please kindly adjust it. Please. To avoid, you can off it, please, to avoid accident.
So fresh, so clean. Love me in and out.
Are we together? Okay. Take like this. 1, 2, 3, 4, 5, 6, 7, 8. Come on. 10. Want to see your right hand? Right hand on your chest. 5, 4, 3, 2. All you have to do, 1. Come on. 2, 3, 4, 5, 6, 7, 8, 9, 10 more to go. 10, 9, 8, 7, 6, 5, 4, 3, 2. Other hand. 1, 2, 3, 4, 5. That's 6, 7, 8, 9, 10 more to 9, 8, 7, 6, 5, 4, 3, 2. Double hand now. 5. Double hand. 1, 2, 3, 4. Now 5. That's 6, 7, 8, 9, 10. Okay. Hand on your waist. Take this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 more to go. 10, 9, 8, 7, 6, 5, 4, 3,
More music on
2.
trendybeats.com.
Okay, take this for me. I want to see you move. 1, 2,
trendybeats.com.
3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Jump up. 20 seconds. 1. Both legs. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 more to go. 10, 9, 8, 7, 6, 5, 4, 3, 2. That's 1. Take this kick. Kick. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 more to go. 10, 9, 8, 7, 6, 5, 4, 3, 2. That's 1. Look at this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 more to go. 10, 9, 8, 7, 6, 5, 4, 3, 2. That is 1. All right. Thank you. Thank you. Thank you. Thank you. Thank you. So please, just 2-3 minutes. Let's have some demonstration. You are at the office. So many of us will sit like this. A lot will sit like this. You want to be the chairman. You want everyone to know that you are the MD, you are this, you are the manager. But it's actually wrong. You are hurting yourself. Sit like this. Okay? Sit. You are hurting your spine. Please, your spine is very, very important. So at the long run, when you keep sitting, pressing the phone like this, you get to a stage. This is how you'll be walking. Yes, you've disfigured what? The spine. So, no matter how big or the chair, the seat is, of course, if we are not like this, we are like this. So, when you sit for about 3 to 5 hours, stand up, take a walk, round, come back, round again. So at this point, open your legs wide. Take this. You hear some sound. To the other side. Both hands on your lumbar, which is your waist. Take it back. You are the last. Take your hand this way. Take the other hand. So simple. Okay? So that is 1 based on sitting. Now, so many of us at night want to sleep. That's where comes the major problem. You finish eating, just maybe 2-3 minutes. The next minute, you are lying down. You lie down, you lie wrongly. So many of us will lie down with our chest. It's actually very wrong. Some people say, that's actually my best sleeping position. No. Sorry, you lie down this way. You see this or this. Okay? At this point, this is one of the best because you are balancing the movements. But going like this, extremely wrong. Okay? Because the food you eat can be thrown up. You can as well manage yourself like this. But mostly advised, at night when you are asleep, should understand yourself. After 3 hours, 4 hours, or 2 hours, change your position. please, you need to balance left, balance right. Some will tell you, I slept when it was break, my neck is paining me. Why? Because the weight was more. Are we together? Now, it comes to water, please, like they have all stated all, drink at least minimum of 2.5 liters of water every day of your life. There are some issues that people have in this life, just lack of hydration, which is water. Please, we need water in our life, please. It's not only at the gym you can exercise. No matter how small your apartment, your compound, your office, you can work out, please. Don't say because I can't afford gym. No, typical lie. Even when you go to the gym, it's not all about the gym. It's about the trainer you're working with. So many trainers know, so many don't know. So you should just align yourself together to do. And another thing is that posture. Even while you're working out at the gym, please, that posture matters a whole lot. That posture. Some go to the gym, at the end of the day, you hear, oh, coach, after that workout that day, all my waist, all my body is paining me. But did you remember to stretch with the coach after the workout? Sometimes coach might be occupied with so many things, classes on his head, he will forget you. But just remind him, ask, coach, please, can you stretch me? It helps a whole to relax and spread the workout. Thank you once again. I'm Coach Obi from Fitness Plus.
Thank you very much, Coach Obi. He gave us practical and theory. Thank you very much for that. That was beautiful. How are you feeling? How do you feel? I can see mommy. Great. Like, I'm sure if they play I Feel Good, mommy is up and dancing. Da-na-na-na-na-na. I can see it. Mommy is ready for vibes. Don't worry, it's Saturday. We'll soon be done. So you can go and enjoy Owambe and parties. All right. Now we're going to our next panel session, and it's our tech panel. And we will be talking on innovating into the future for healthier lives, tech in Africa's nutrition and health landscape. Amazing speakers here with us today. First of all, our first speaker is the co-founder and CEO of Checker, a digital health platform that connects users to verified medical laboratories. He's loved, though. Offering home sample collection and results within 24 to 72 hours. He holds a bachelor's degree in economics from Adekunle Ajashin University and completed the Nexus program at Lagos Business School and Henley Business School. With over a decade of experience in sectors like education, he won the Africa Regional Finals at the Founders Live Pitch 2023 and was recognized as one of Nigeria's top 25 innovators by the Nigerian Sovereign Investment Authority, NSIA. Victor is dedicated to using technology to address Africa's healthcare challenges. Ladies and gentlemen, please welcome our first speaker, Victor Emaye. Sit there. You know, I told you we have is a clinical dietitian, culinary ethics with culinary skills to create innovative meal solutions. As a tech entrepreneur, she leverages technology to enhance nutritional education and accessibility. Additionally, she shares her knowledge and insights through television hosting, making nutrition engaging and accessible to a broader audience. Ladies and gentlemen, our next speaker, please welcome Tito Ikpimoye RD. All right, she's slaying. Yes, girl. Here. Thank you so much. And of course, moderating this panel again is your humble MC, me. A round of applause. All right, so you can sit there. Thank you. Thank you all so much once again for being here. Looking forward to this session because I know it's going to be amazing. Of course, like the usual, please jot down your questions, and when we're done, you'll have the opportunity to ask whatever question you have. So please take note. All right, like I said earlier, the topic for this session is innovating into the future for healthier lives, tech in Africa's nutrition and health landscape. Okay, and I'm going to start with Checkers, because I see you have a lot of fans here today. Hi, Victor. All right, first question. What are the most pressing challenges in Africa's healthcare landscape that your technology aims to address concerning non-communicable diseases, and how have you adapted your solutions to meet these unique needs?
Thank you very much. I must say it's good to be here, and thank you, Dr. Jisuk Belumi, for inviting me over. Quick story, because that's how I found the problem. My mom came down with a stroke a couple of years ago, and I was already in the healthcare business, but I was doing something. And when she's ill, Mom, she would not go to the hospital, right? Even though we have a family doctor, most of us can relate. Even though we have a family doctor, most of us can relate. The family doctor will recommend some tests. She says she's too busy. And 50 years, so many years down the line, she came down with a stroke. I really struggled with it.
Very much. That was very insightful. Thank you for taking very much. That was very insightful. Thank you for taking us to your origin story. Tito, I would like to ask you the same question as well. What are the most pressing challenges, in Africa's healthcare landscape that your technology aims to address concerning, non-communicable diseases, and how you've adapted solutions to these unique cases?
Can you hear me? Yes. Okay, so I'm a tech founder turned employee, so let me put that out there. So I built my first tech product, and then I joined another startup, and we're doing the same thing. Just a backstory, like he said, in 2016, when I used to work at the National Hospital in Abuja as a dietitian, and they say somebody just went into coma and he died because of high blood sugar. It never used to make sense to me, because as a dietitian, I know how easy it is to manage diabetes. Diabetes of all things. That is just, don't eat this, don't eat that, and you're fine. And people were dying, people were getting amputated. Every other day I am in the ward, and we are trying to do some magic so that this person's limb doesn't get cut off. And it's so easy to manage. And in 2016, it never made sense to me. I was a very young dietitian then, so I just felt people just don't listen. When you go to the ward and you say, oh, don't eat this, and some patients, very stubborn, when they give them food from the kitchen, they will not go and bite their own. Patients are stubborn. And it just looks to me like people didn't love their lives. Then I moved to Lut in Lagos, and then I began to understand that the problem was people did not just have access to the right kinds of tools and resources. So we go to the ward and say, don't eat this, don't eat that, but you're not telling them why they shouldn't, number one. And even if you tell them why they shouldn't, the doctor will say, okay, come back in the next 3 months. What happens between the time you are seeing the doctor and in the next 3 months? Who is keeping check? A lot of people don't even know what their blood sugar value is saying. And so when I was going to build a product around that, because I'm so passionate about diabetes care, I started to look at some of these problems and started to ask questions like, what can we do better, to solve the problem? And that's why wherever I work, and we work with diabetes patients, the first thing I do is try to build tools that would help the patients that we are managing effectively manage their condition.
I love how you said effectively manage their condition. So it's not a one-size-fits-all.
No, it's not.
You have to, you have to know your patient, and it's a very one-on-one, thing. I really like that. So we have like two opposites of the spectrum. You have a tech that everyone can access, and you have one that is, specialized to each person. Victor, I would like to ask, how does local culture influence the adaptation or the adoption rather of tech-based solutions in health? And how do you tailor your technology to meet these cultural nuances?
Thank you for that question. Sadly, right, not everybody can afford the kind of technology that exists today. I noticed while I wanted to solve this problem for everyone, I noticed that the target market really is people in the middle class, so even the high class. I think a bulk of my patients this year have been HNIs, right? Because they can pay my money, right? But what happens to people in areas like Alagbado, where I grew up, right? And to solve that kind of problem, I created another arm of Checker called L-Check Africa. And simply put, we go into different communities routinely to run checks for them at no cost. So we raise funds from people like you, and we take that into the community, get doctors, nurses, phlebs to get their samples, and we share their results, also give them medical advice, right? I think that that's one little way we can solve that local barrier, because I mean, a lot of them, probably the best kind of healthcare they would have access to is primary healthcare, and sadly in a country like ours, you can't get quality care in primary healthcare center today. Right, so most of them, they don't want the queue unless it's very bad, right? And that's not preventive. One thing I would say is one of the major aim of this event is to promote the preventive culture. And in one way, we're trying to pass that down to the grassroots communities by helping them do routine checks. Once they see it's for free, they will do it. But if you have to pay, how many of them can even really afford $1? $1 is increased every day, so maybe it's so sad, right? So that's our little way of solving the problem. And the best way to even scale this up is to have more people think about how they can do this in their own community. I can't be in 36 states, but I mean, you are in different areas and we can also support those doing this great work. Yeah, thank you.
Thank you very much for that, Victor. Yes. Tito, I would like to ask, you know, in terms of diet, how would you say, or what impact has your platform had on promoting healthier diets and nutrition awareness? And what metrics do you use to measure these impacts?
Okay, so one story I like to tell, we run a nutrition clinic. When a patient comes in, and you tell them you can eat absolutely anything.
Sounds beautiful and amazing.
You can imagine somebody that has been eating only unripe plantain and beans for 15 years. And you say, no, you can eat your rice, you can eat your eba, you can eat your... And the person is like... In 2019, an old man, a 60-something-year-old man, literally cried when I told him that because for 15 years, he had been eating only unripe plantain and beans. And so I said, oh, you can eat eba, you can eat fufu, and he started to cry.
The joys of eba.
Like, it felt like 15 years, you know. And so, fast forward to now, we run a 12 weeks program where we help people reverse their diabetes. And first things first, when you tell anybody you can eat absolutely anything, they would ask you, so I can eat rice? Yes. So I can eat eba? Yes. I can eat pounded yam. I'm from Ekiti. And one of our family friends had diabetes, and I think the hospital in Ado Ekiti told him, Baba, you will stop eating pounded yam. And he said, well, something has to kill a man. And he went back to the village to die because he couldn't imagine not eating pounded yam, you know. And so bring that to Lagos and, you know, anywhere else. And when we're able to tell people they can eat their locally available food, it's like a blessing. And so how do we measure that? In 12 weeks, we have over 92% success rate in helping people effectively reverse their diabetes to remission. And for people that are pre-diabetes, it never gets to the diabetes stage. And so we're just saving lives, you know, the way we can.
In fact, I was about to say that deserves a round of applause because it's so funny how we talked about pre-diabetes and diabetes in the first panel session, and in the second panel session, there's already a solution to curbing that. I think that's fantastic. I think that deserves another round of applause, honestly. Okay, Victor. Just generally, just for you as well, just the way we've heard, how they've been able to reverse certain results, just for you as well, what impact will you say that Checkers and, Health Check has had, and how were you able to gauge, like what metrics did you use to gauge?
So for us, right, you go into a lab and you don't have to pay a bribe, but you are going past the queue, right? So most people that use Checker typically have to get a test done in different labs, but they skip the wait times. So we have sort of a queue management solution, and we have these concierge services for our clients, and that's if they have to walk in. So the joy of not having to burn fuel, it don't cost, right, to go to a lab. The joy of having to skip the queue when you're booked for a radiology, let's say MRI or CT scan or X-rays. So for us, we typically will reduce, if you're supposed to do a test and if you're supposed to spend about 5 hours in the lab to get all of that done, you can do that within minutes from home, right? Also getting results, you can get it same day, 24 to 72 hours. And that is one major thing. For us, access to care, how do we even measure this access? You have it anytime, any day, 7 days a week.
So I have to ask you, because I'm still trying to, understand how it works in particular, because I remember in 2019 when I had to get an MRI done, and I remember how we had to wait for 2 days because we legit had to book ahead, even though it was an urgent matter. And, I also remember how big the machine was and everything. And now you're saying you can do it from the comfort of your home. So please, can you make me understand how that works? And, just for every single person here as well, we would like to know, I'm sure you probably cannot recite it all, but all the tests that Checkers has allowed people carry or do from the comfort of their homes.
Okay, so I would not like to cast doctors so much here, but there's blood work, right? Tests that you do, samples, like you draw blood samples, we can do that from home, right? So you typically have to queue at the lab to also do that, or you can get it done from home. And how that works is we have phlebotomists everywhere in Lagos, Abuja, and Port Harcourt. And in Lagos, except Ekpe and Badagry, that place is far enough for us. Don't mind me. But if you want to get a test done here now, we have people in VI, trained, verified, sample, phlebotomists. So they are skilled in the act of sample collection. And they typically work in healthcare facilities that around. But the way the healthcare business is, they do shifts. So for 4 days, they might be at home waiting for their next shift. So during that period, they are on the road, on field, drawing samples for us. Now, for radiology, where MRI falls under, right now, Checker has laboratories in 120 locations. We know the price, we know the availability. And so, you were working with just one lab. We work with more labs. So we know where to send it so that you literally not have to spend so much time. So we have a lot of labs in VI, in Lekki, on mainland, and some of them have like the MRI machines. So we book ahead, and because of the kind of partnership that we put with these labs, the kind of numbers we bring to them, they sort of prioritize our clientele. Yes, so that's how we're able to get it done. Power past power.
Power past power. These two people here are the real definition of I get backing. Because imagine when they're the ones that send you, you just strolling. That's absolutely amazing, to be honest, because not having to queue. Even, I was having a conversation with someone, and then the person said, how did we from an ATM using country become a POS using country? And deep down I said, people don't like to queue. ATM queues stress, but POS, you're going There is no queue. You do, you go. You're paying for fast, for speed. And that's basically what it is. And to know that even this in healthcare, that's really fantastic. Well done. You all make tech look easy. And we know it's not. It's a lot of work. It's a lot of codes. Tito, I would like to ask, how can digital health and Nutri-Tech platforms collaborate to offer a more integrated approach to health and nutrition for users across the continent?
How can we collaborate? What are we collaborating with? Other healthcare?
Yeah.
When I was building, so the first version of, for example, if I'm in a party, and like she said, I want to eat jollof rice, and I want to know that if I eat this jollof rice and I'm managing diabetes, my blood sugar isn't going to shoot up, right? I don't want to have to call somebody to ask for that. I want to be able to have access to easy meal plans or recipes. What I need is a self-care platform, right? But also, I need my doctor to somehow know what I'm doing without actually talking to my doctor to somehow know what I'm doing without actually talking to the doctor, right? And so how we can trying to do differently at Medicina Clinic, because we check our patients give us their blood sugar value every morning. So we don't have to call them. But any morning that I can see abracadabra, how far, And I think that that's what we need, how far, And I think that that's what we need, around food, nutrition, and healthcare. We need people to have access to their own health, while doctors, nurses, and whatever their primary caregiver should also have access to that information, so that if something is going wrong, they can quickly check in with us. So I think that's what we need globally.
I like that. If I round everything is just inspiring. I like that. If I round everything is just inspiring. Everybody's just giving applauses for everything that they say. It's really, I'm being educated right now. And while you were speaking, a question came up, and I just need to ask. We've seen everybody, your family hospital, you're registered in one hospital or the other, they always have your file. So every time you go, they have background check to see your history and where you're coming from. But the thing or the issue that we've seen with things like is maybe he's diabetic, so we don't know that he's not going to heal on time. And maybe because wherever the accident happened, they rushed him to maybe just one random hospital.
Let's just imagine that tech companies like Checker and Mediterranean Clinic, or as like Checker and Mediterranean Clinic, or Cito Health, right? Yeah, tapping from that same database, right? I can seamlessly integrate with her and say, yo, I've got a patient who needs a dietitian. She doesn't even need to give me commission. She can keep it. Don't mind me. But that's how the business goes. We thrive on all these commissions. Yeah, but we can do that referral across the board, right? You can get a gynecologist, you can get a nutritionist, because you know where they are. We're all tapped to one system. We also have access to these records. Anything a doctor or a medical practitioner imputes, we can find it. I don't know how long it would take for these to be implemented, right? Because right now I'm building a product for an health tech company in the US, and every day I cry because it's not useful to us in Nigeria. They've advanced to the level that all hospitals, private clinics are interconnected, right? Even to all the insurance companies, everything connected. And the kind of problem they are having now is that when they want to fill forms, when they get to the hospital, they have a lot of forms to fill so that the doctor has adequate information. Now I'm automating that process for them, so they fill all those forms from home and they book an appointment ahead.
Wow.
Right, so if we do that one in Nigeria, nobody will use it. There's no form to fill. You have to still go to the hospital to queue. The database is fragmented. and all that. But I know that progress is step by step, and I want to congratulate the Federal Ministry of Health. Whatever they've been doing now, let's just keep pushing and not cancel it after the end of this 4 years.
Amen.
Yes.
We will join hands in prayer.
Can I also add to that?
Yes,
so
please.
This is even more of a personal story. I was in the hospital yesterday, and then I asked the doctor a question when they gave me my result, and he said, well, I don't know, I don't have access to your history. And so he couldn't give me an answer. I don't have access to your history. My friend's mom died. She walked into the hospital by herself on Friday to complain that she was tired. And she's not a medical person, and she didn't know that the drip they were giving her was glucose, and she's diabetic. And they pumped her with glucose, and by Sunday, she died. Again, she walked into the hospital by herself. And there was, she didn't know. And so by Sunday, her children had to come and carry her dead body, And so if we had solutions like, what you're talking about, I feel like, yes, it would go a long way. But I also think that doctors don't like to share information. I have an agenda against doctors, I'm sorry. But I think that they also don't like to share information. So I think that we also have to get to a point where healthcare professionals are willing to share information and data. That's the only time tech can do anything.
That's the only time tech can do anything. So it still boils down to the human factor as well. Well, thank you so much, Tito. Thank you so much, Victor. I'm sure our guests have questions, one or two. So if you do, okay. Do we have anyone who would please give our guest the mic? Thank you. Our fitness mommy has a question. She was so excited during the exercises. All right, mommy, please tell us your name, and then you can ask your question.
My name is Iyabode Bello, and I really want to appreciate my darling Dr. Pelumi for this summit. It's really, really, really awesome.
Yes.
And it's educating too, I must say. Yes. I want to ask a question, but I have to explain some certain things before I ask about myself and my health. I hope you don't mind.
We don't mind, mommy, but we will just need it to be very fast,
yes, it will be
because
very
of
fast.
time.
So, like 5 months ago, I was having this dull pain in my upper left side of the abdomen. So, well, I was worried, so I went for this lab, what is it called, NICUR. So I did all the general tests, and all they could come with is everything is okay, but that I have high cholesterol, and I was given some drugs that I took. Anyway, to fast track it, I traveled and came back like a month ago. All through the period I was over there, the pain was not coming again. That I was even asking my daughter, Pelumi, that I am having some pain, and he said, Mommy, don't worry, exercise, okay, all right. So now I started having the pain again, and I was worried. Then I went to the hospital. I went to the hospital and showed them all the results from NICUR. And the doctor, very young lady, said, okay, Mommy, you are okay, but have they texted you for, have you been to the lab for bacteria inf? I said no. Then she's asked me to go and do it, and I came back. And they now said I have this pipe. That's why I'm holding my phone. Yeah, I want to understand the, I'm sorry, please. So, so they told me I have Helicobacter pylori infection bacteria. So they gave me so much drugs that I was wondering whether what is it? They gave me all sorts of drugs and I'm on it right now. But the question now is, was there anything I have done or not doing that I have to come out with this kind of bacteria, or is there any other thing I can do, like the dietitian will say? Or is there any further text I have to do? Because when I went through the meaning of this, they said it can even cause cancer. So I'm worried. What can I do?
Okay, ma'am.
Thank you.
After this session, I'll come and do private consultation. H. pylori really is gotten from just simply infected food or water, and that's one of the things that why we speak against eating street foods, especially in Lagos. I recently had the same issue. I have gut issues. So I'm a dietitian, but you see, I have a very nasty lifestyle, and
you're stubborn too.
My father will say, if your patients see you, I will snap your picture and post it on Facebook so that they will not. I say, Daddy, do as I say, not do as I do. You know, that's why as much as possible we preach eat homemade meals. Mine was even very bad that recently, just a month ago, anytime I eat out, I will start vomiting and I will start stooling for hours. So now, if I cannot cook at home, I stay hungry, you know. And so one of the easiest ways to do that is when we eat out, eat infected food and all. And so that's why people say, when people say to me, oh, I have ulcer, the first question I would ask them is, have you gone to do the H. pylori test? You know, and that because that's the most common causes of ulcer. So yes, the drugs are just to help you, you know, cleanse your system from forward as much as possible. Ensure you eat homemade food, because that's the only place that you are guaranteed that this food I am eating is cooked well and with clean water. So that's just the easiest answer.
Thank you very much for that, Tito. Do we have any other question? One more. All right. The mic. Okay, so the mic.
Good afternoon, everyone.
Good afternoon.
Yes, congratulations, Dr. Pelumi, on this new journey. I think that this is helping a new generation, right? The elderly generation might try to take care of themselves with this information, but for the coming generation, it's going to prevent a lot of issues that we know. But the question that I have to you both tech gurus on the panel, excellent work that you guys are doing individually, but you sort of answered the question, but I just want to direct it in the sense that internally, how are you guys both storing data and doing projections or doing analyses of the data that you are fetching? Because you're getting a lot of data from the work you are doing as a dietitian, people that are giving you, and I'm really interested in how you're getting the blood sugar level of your patients daily, right? But that data that you're getting, how are you using it for projections for people in different demographics, right? We know about how, and that data might be segmented because maybe your clients are just basically in Lagos, so it's just a mini data set, but how are we using that data to help other people in other spheres? I don't want to go too deep into the question, but I believe you understand what I'm saying. Yeah. So
how we get our data currently, again, the continuous glucose monitoring is not yet available in Nigeria, so we have to depend solely on the data the patients give us, you know, and so we have to educate them on, please collect your blood sugar value every morning. We currently have a chatbot that sends them messages every morning. Good morning, ma. Good morning, sir. Please, what's your blood sugar value this morning? And, you know, it's very consistent so that they do not forget. But what are we using it for? So in 2022, when I built the first version of Cito Health app, what I really wanted to do was to build an app that would based on my inputs in this month, it should be able to project and tell me what my blood sugar value would most likely be over the, did I have that conversation with you? Over the next 3 months. So if I put my blood pressure, you should tell me that based on your lifestyle, if you are not careful, you will most likely have a stroke, you know. And so machine learning, we don't have those kind of data presently, and so that's why we have to manually take all that data and feed it into, you know, our system. But that's what we are using the data for, so that we get to a point where people on our app can say it can predict, you know, predictive AI, say over the next 3 months, if you do not take care of your health, this is most likely going to be the outcome. Thank you.
Thank you very much for that, Tito.
Yeah, so for us at Checker, right, one major way we collect data, of course, through our platforms, but you notice that most healthcare people, they like WhatsApp chatbots. So most of our patients, we also engage them through WhatsApp. But for us, how do we act on this data that we get? 2 ways. We're currently building an AI algorithm to help instantly interpret medical reports or results. For example, mommy's results. I'm sure mommy had to go back to the doctor with that result. If you had Checker, with the new technology we are building, right, you probably understand your results right on the spot, right? And we're trying to now integrate this into a broad range of diagnostic center. So as against just building a platform, we are looking at a broader view of building an infrastructure such that any lab that uses it, when their patients are getting their results, it comes interpreted. So you get the standard results and you get the interpreted one from the Checker AI bot, right? So simple process. We've tried to do this manually. Trust me, the doctors that were doing it, they felt it was a lot of work. Imagine interpreting a lot of results day in, day out, and trying to document it for patients to be able to get it. So another broad view for Health Check Africa going into communities is to really get real-time insights, right? So let's say we're able to do for 1 million patients over the next 10 years. What do we do with this data? In Nigeria, we don't have it, right? And people have to start from somewhere, right? So we've started going to communities, doing free checks, getting data, getting their name, understanding what ailments they have, and also now comparing these numbers that they've got. With that, we can now say, oh, the data we are providing to the government or to research is accurate, right? Right now, most data are not so accurate. When you want to get data on Nigeria, you probably be seeing Africa, or you probably be seeing global scale. So that's how we're currently working on it. Yeah.
Thank you very much. They deserve a round of applause. Please, a round of applause for our speakers. I mean, it's amazing to see these innovations that are, you know.
Sorry, I have a question.
Okay.
Okay.
All right. Okay, so that would be our last question for today.
Good afternoon, everybody.
My
name is Babatunde Adekombi, Digital Content Creator. Kudos to Dr. JP on your inaugural edition.
Yes.
We look forward to more of it. I mean, the session so far has been insightful, more particularly this tech-inclined panel session. My question basically is, you both shared insights on, I mean, the work you've done so far, I mean, the app creation. What measurable steps have you taken for people in the rural communities? Because whether we like it or not, as we speak of as of now, we still have some demographics in the rural end that still believe so much in these local hubs. Understand? It takes a lot of work to really convince them, and particularly on the hub, you know, a lot of education has to be put in place. So what measures are you taking? Are you putting up programs consistently to educate people in the rural end? I mean, definitely your app must be user-friendly for people to be able to use it adequately.
Yeah, thanks for that question. I think that's very apt. I might not be able to talk too much. I mean, on my end, I mean, we're doing free checks and all that, but that's not enough. One of our major partners, AXA Mansard, I must talk about them. They're currently collaborating with the telcos. So I want to assume that people in rural areas use mobile devices, even if it's the Balasa, right? and they have SINs. So it means that they can subscribe for what is called micro insurance that gives them access to talk to a doctor, get access to medications, and even do primary care diagnosis, right? Malaria, full blood count, and just basic tests, right, that they need for primary care. So we have organizations like that trying to put together initiatives that would reach out to people. I'm sorry to say, but with the way Nigeria is going, if you were in the middle class last year, this year, I don't know what class you are in, but you have dropped. So you can create a new one. So you cannot understand the purchasing power parity of each and every one of us in this country. It means we have more people that cannot afford the kind of health care that you get in Evercare, right? But there needs to be a means for them to access this care, and that's through micro insurance. So it means, oh, you bought data, or you bought airtime of 200 naira, they remove 20 naira, it accumulates. You bought another one, they remove 50 naira. But you're buying insurance, you're able to talk to a doctor, you're able to get access to medications, and these, they don't need to download any applications through the phone number. Aside the outreaches, this is another way healthcare companies are collaborating to provide access to care across different locations. And it's not just Lagos, even in the north, they have access. Yeah, thank you.
Thank you very much, Victor.
Thank you. Talking about Agbo,
you need to talk about it.
You cannot separate an African man from his Agbo. I have said it. My father does Agbo in the house. When I come back home, he has different, I'm telling you, different concussion. One day he has this leaf, he has that leaf. One day he even harassed me that let me teach you how to do this thing so that you'll be giving your patients. To him, I'm a wayward shy. I mean, he can borrow because he wants to teach me and I've refused to learn. And I remember that at different times I have come out to talk about the dangers of drinking Agbo, and you tell me my head is not correct. I know that when it comes to drinking Agbo, there's really, really nothing that you can say, especially for people that it has worked for. And I understand the argument, because these were the things that our forefathers were drinking. And even when it comes to drugs, these are the things that makes up for the tablets that we swallow every day. But my argument really is, how do you now quantify it? How do you remove the toxins from it? You know, but we can only educate as much as every time I go to do a health talk, I always have to talk about Agbo. And what I would always say is, how are you sure that the portion you are drinking is not toxic to your health? But we keep saying it. You know, we'll keep saying it. And how do we get, talking about tech, I think that the problem, the misconception when we talk about tech is that people always just think that it has to be an app. One of the things that I had to do differently when we do consultations, because number one, our clinic is somewhere in Lekki. Not everybody, even me, I don't like to walk around in Lagos because of the long hours of traffic. And so one of the things that we started to offer is telemedicine. So you can access a dietitian from anywhere around the world. So we're not limited to Lagos. We talk to people in Ghana, South Africa, in the US. But we also know that not everybody has access to WhatsApp. Not everybody has access to Google Meet. And so we started to do consultations via phone calls, you know. So you don't always have to have the most amazing phone. Just have a phone number and my dietitian would be able to reach you from anywhere around the world.
Is it free?
No, the consultation is not free.
It's not free, mommy. All right, thank you all so much. One more time, they deserve a round of applause. Please give a round of applause to our panelists as they rise. Dr. JB, we would like you to come up to take pictures with our amazing panelists. Did you enjoy that panel? It was very beautiful, in fact, and very engaging. Thank you. I learned so much. That Agbo, I still fought with my mom this morning. Growing up, Agboba, Agbo ile tutu, Agbo malaria. There is Agbo. The one you use to bath, the one you drink hot, the one you drink cold, the one they will cover your head, you inhale. Everything. Agbo. This morning, I was still, because I had a cough, and I know what is causing the cough. I'm allergic to strong perfumes. I inhale it, I have cold and cough.
I know the drugs I take. But my mom said, this one that is always reoccurring, I just said, Mommy, okay, thank you, no problem. Because that argument is going to go on for hours. All right, thank you so much, Tito. Thank you, Victor. Beautiful, beautiful. All right, we're going to our next panel session, and this one is for our, 1 second, please. We're going to have one more exercise. Don't worry, you're not standing up. This is another exercise for, another brain exercise. So get ready. This one is harder than the last. So if you did not get the last ones, may the Lord be with you as you try this. But I mean, we're doing this so that you can also go home and practice it. Like I said, it helps with your cognitive functions. And then after that, we'll be going into our pioneers session. Our policies session, our policies panel. All right, so fingers up, your hands up once again. All right, so let me just tell you how effective this is. So based on research, these exercises, they help your cerebellum, they help you, they help you focus your attention, they help your motor cortex, and they help your median nerve. The doctors in the house know what I'm talking about. I don't know what they are talking about. I just know it's an exercise and it's beneficial and I do it. All right, so fingers up in the air. Okay, this one is hard. So if 1 and 2 you do not get it, please, do we have medics in the house to help us untwist the fingers? Tobatilo. We have to unload it. Okay, I need someone to help me hold my mic again, please. Hi, my sweethearts, please come help me. Thank you. So now, we know, a round of applause for our beautiful volunteer. Thank you for always helping me with the mic. So you know when they say fingers crossed, you know how they say fingers crossed? So cross one finger in one hand. Now, the other hand, you do okay. Do you want me to demonstrate again? And this time around, we're going to do 20. I believe in you. You say, Steve, my volunteer wants to fight me. Yeah? All right, so this, and this, and this, and this. So we're going to do 20. Because this is the only one in this level. Because there's none like it. So are you ready? 3, 2, 1, go! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. See, everybody has stopped. Nobody's doing anything again. Thank you. No round of applause. Ma? Do you know how many times I've tried this, Mommy? My first, second, third, fifth time, I was a mess. But I mean, these are things that help you with focus. And most times, it's also about memory, because now it's not just your brain, even your fingers, you're working with your nerves as well. They said sometimes it helps that you don't look at your fingers. So you're using your memory, and that's where working it out, exercise comes in. Okay. So many things. This internet, there's nothing they've not done there. All right. We're heading to our policies panel. And this is also going to be another amazing one because we've talked. Hi, Dr. JP. Dr. JP, don't worry. Your time will come. You'll come on this stage. That voice, we shall hear it. But thank you so much for putting such an amazing event together. This is beautiful. One more time, please, Dr. JP, Jesukwelumi Adenihu. We're all here because of you and your vision. Thank you so much. All right. we're going to our next policies panel, and I will not be the one moderating. Ladies and gentlemen, please, I would like you to welcome on stage our moderator for this panel, Ashabi. Please come up on stage. Please give our moderator a round of applause. Thank you so much for being here and doing this for us. Thank you very much, moderator, able moderator. We see you, we love you. All right, in 2015. Now, with a Bachelor of Arts in History and International Relations from Lagos State University and a master's degree in entrepreneurship and innovation at the Rome Business School, she transitioned into education inspired by her husband. She holds a postgraduate diploma in education and is certified in early years foundation stage and inquiry-based learning. With over 12 years of experience, she is passionate about nurturing the total development of children, guided by her philosophy, what you do not nurture cannot in the education sector. She is a mother of 4 loving sons. Ladies and gentlemen, please welcome Bukola Arivisanla. We're so glad to have you. Thank you so much. I'm looking forward to this panel session. All right, our next speaker has over 20 years experience in airline management, aviation consulting, business development, business jet, travel technology, and as well as destination management. He holds an MSc in Transportation Management, Aviation Management from Ladoke Akintola University of Lagos, University of Technology, Ogbomoso, and a BSc in Political Science from Ekiti State University, then Osua. He was at different times head of PSA Offline Management Nigeria for Onboard.com, country manager for Sojo Flights USA, head of sales and business strategy for Transatlantic Logistics Services, and head of marketing and sales services, and head of marketing and sales for Discovery Airways, where he oversaw all the commercial activities in Nigeria, as well as Responses Limited. Ladies and gentlemen, please welcome our next speaker, Ayobamidele David. Say a round of applause as he makes his way on stage. Thank you so much for being here today. We are truly grateful and we appreciate you. Our next speaker for this panel session, we've seen him before. He led us in an opening prayer. You know, he ensured that we started this event on a fiery note. Ladies and gentlemen, please welcome once again Commodore Abimbola Ayuba, retired, National Director of National Issues and Social Welfare of the Christian Association of Nigeria, representing Archbishop Daniel Oko, the President of the Christian Association of Nigeria. Please, a round of applause for Commodore Abimbola. Thank you so much. You are here right from the beginning and you've stayed with us all through. We appreciate you and we are grateful. All right, this panel session is going to be another beautiful one, and we will be talking on the policies for a healthy Africa, exploring cross-sector strategies in promoting nutrition and health. And I will be honorably handing over the microphone to our moderator, Ashabi, to lead us in a beautiful session. Ashabi, over to you.
Thank you very much. Please give Pelumi a big round of applause. I feel like she has set such a high bar, but we will do our best, Abby. Thank you. So let me introduce myself first, and then we would come to the business of today. So my name is Dr. Asabe Meyaki. Asabe, not Ashabe, but I forgive her. I'm a medical doctor and a global health professional, and I have a master's degree in international healthcare economics, policy, and management from SDA Bocconi Milan. And I say that to sort of demonstrate how excited I am about this panel. And to also, people have been repping their different schools, but, we that are from University of Lagos, we are here. Greatest of the greatest Akokites, where I know you are here. Thank you. Thank you. You will always know they are there. So thank you very much. So I want to give some context to why we decided to add this panel. As at when we decided to plan this summit, I've been in many summits. I've been in different conferences. And it sort of looks like just after the conference, everybody goes home and that's it. But I remember JP and I are classmates, so it's like a full circle moment for us. And we had a very good discussion, and we sort of agreed that we didn't want it to just end as just another summit where people come and that's it. So we agreed on two things. One, and after I say these two things, I really want you to appreciate Dr. JP, because I know the work that went into the two things. One is, at the end of this summit, we will get feedback from everyone here. We want to be able to measure and objectively show if this summit has had any impacts. I know a number of you have filled one before coming, so we will measure. The second part is everything that is said in this panel will feed into the policy action that we will take next. So I want you to understand that when we're speaking here, it is because there is a direction. So please feel free to speak. And it also means that in the audience, please feel free to follow. And please ask them many questions so that we can have a rich discussion. Are we in agreement? Thank you. So this is where you put your hands together for Dr. JP. Thank you very much. So let me start with Commodore. We had a nice short discussion before now, and I really like how diverse this panel is. I mean, we have an airline represented, we have education, and we have faith, Christianity represented. So let me start with you, sir. When you think in terms of health and nutrition, where do you think faith-based organizations can come in terms of the role that you can play?
Thank you. Thank you very much. Let me just quickly convey felicitations of the President Christian Association of Nigeria to this very, very auspicious and noble summit, because I can see that even the angels are involved in the planning and execution of this. So directly to your questions, your question on what faith-based do. There's a lot of interventions, contributions that faith organizations can do. Firstly, because faith-based organizations are having the nexus between divine possibility, that's our creator, and then the church or the mosque, as the case may be. So through the pulpit, there's a lot of communication going on. And considering the vastness of multiplicity of churches, doctrines all over the country, find out that there's a reach. And let me quickly come back to the Christian Association of Nigeria. The CAN, for about 48 years, was established 48 years ago. We're going closer to 50. It began as an association to manage the issues of the clergy. But by and large, CAN has evolved to dealing with the whole gamut of issues, social issues, national issues, for which health and nutrition is a key part of. And back there, the directorate that I head is Directorate of National Issues and also Social Welfare of the Christian Association of Nigeria. So it means that any issue that borders on social welfare, for instance, poverty, health, nutrition, falls directly in my own purview under the supervision of the CAN president. So right now, faith-based organizations like ours have been collaborating at the very highest level with so many agencies, the United Nations. We also have been working with the World Bank. But there's a particular package we are doing right now, which I'm deeply involved in. I had to quickly leave that to travel down to Lagos for this particular event. That shows how important we are taking the issues at hand. So we are doing nutrition. There's a program called Accelerating Nutrition Results in Nigeria, which is purely funded by the World Bank, collaboration with the Federal Ministry of Health and Social Welfare, also CAN. And we have had a lot of interventions. We are looking critically at issues of maternal, infant, young child nutrition. And we discovered that based on research work, that there are about 11 states in Nigeria that are falling short of the benchmark for nutrition, particularly for child nutrition. So we are working with those 11 states. I don't know if I can just quickly mention a few: Kano, Gombe, Adamawa, Plateau, Kaduna, and it's not only in the north. We have Kwara, Oyo, and Abia, the east. So we are working physically by doing a lot of sensitization. These are things that we are doing right now as I speak. And we had a sensitization, public sensitization, among the 5 blocks of CAN on the 7th of October last month. And on the 8th, we had a planning meeting where we created our own advocacy coalition to support the 11 states. So we have about 70 volunteers already at hand, ready to go around. We are aware the World Bank money will finish. That's in the moving at it, and also we've also been involved with the malaria, rollback malaria program. So by the structure of CAN, we operate from the national headquarters in Abuja, then 36 states of the country. We are in 36 states and in almost every local government of Nigeria. And up to ward level, we have our units. So this makes us veritable partner to collaborate with and partner with, and also that to tell you that we have structures. Most of, about 85% of the states in Nigeria, we have our own buildings and also our halls for meetings where we can do our town hall advocacies and all. So these are areas, and when we observe things that are not going well, we are able to make public statements, even criticizing government or contributing to the national discourse. So these are areas where we are closer to the people through the pulpit, and also we have a very good network of women wings. We have a women wing. We also have a youth wing. So that increases our outreach, and this has been quite effective. We can do more. Thank you.
Wow, thank you so much for that. Before you drop your mic, let me flesh out something. I mean.
One level, we deal with policy formulation, planning, and also working in collaboration with all the government structures, NGOs. When we agree, at the level of the state, we also have we have coordinators for state issues and social welfare. I also add a local government. So we have focal persons. Even with the ANRIN program that we are running, we have state focal officers from the Christian who manage day-to-day affairs of the program and are able to report back through the normal panel report.
All right. Thank you so much, Sarah, because, I mean, now you have answered the follow-up question. So let me move.
Young woman. He kept calling and all. And the question again that came to me was that what's the relation or the correlation between the aviation sector and, you know, wellness, mental health and all whatnot. But she was so persistent, so much so that I said, okay, that's fine. We're going to see what we can do to support the event. So a good one for you. And thank you very much for identifying with the fact that, yeah, the airline Airpeace is the biggest from Nigeria and from West Africa, and you approached us. We are grateful. We appreciate that. And it's more or less like, you know, going back to answering your question, it's like maybe she's done 1 or 2 researches to have an idea of some of the things that we have been doing and what we are currently doing in terms of innovation and enhancing wellness, you know, within the aviation sector. I would like to start with the long haul that you made mention of. I don't know if every one of you are familiar with our social media platform, which has been, you know, redefined and rejuvenated with a lot of the things that we're doing. We wanted to start on a high note by making sure that, yes, we are Nigerians. We are from Africa. Why would our passengers, our people, whether people living in Nigeria or people living in the diaspora or flying, why should we offer you food that is basically foreign? So we came up with giving our passengers food that are more of African heritage, that has enough nutrients in it. Some of us that probably lived abroad before, you understand when the foreigners tell you that, yeah, I want to eat organic food, right? We don't appreciate that much here because this is what we do every day. We want to make our food fresh. We want to eat our food. But for those in the diaspora, they don't have that kind of opportunity. So what we serve on board, right, is to encourage our own local food and to encourage, a level of nutrition that you will get from eating the food on board the aircraft. Our food contains, carbohydrate, vitamin D, vitamin C, calcium, on the long haul, because we need you to be fresh when you're getting to the UK or flying beyond the UK. So these are some of the things that we put in place to continue to lead the pack as the best airline in West Africa. So you have that on board the airline. You eat local food that would nourish and enrich your body, wherever you're going to. We also went further because, of course, other airlines do it as well by more or less like breaking it down. If you're a vegan, there are some food that you can eat. On our menu card, you will see that, yeah, there's a food that you can eat as a vegan, as a vegetarian, and for somebody like me that eats everything and everything, there's also, something for you to eat to keep you, healthy on board our aircraft. So that's one of the innovations that we've put in place, to enhance wellness for passengers that will be flying on us on the long haul, right? And not just the long haul. Of course, we do a lot of regional flights and domestic flights, which of course we do the same. We make sure we give you food that will nourish your body. It's a 1 hour flight or 1.5 hour flight. You have some cookies, you have candies, you have fresh juice that you eat on board that would help to, keep you okay when you are moving from point A to point B. So basically, yes, those are some of the innovations that we put in place.
Thank you so much for that. So, yes, please. I think they deserve it. So this is not an advert for Airpeace, but I believe strongly that when people are doing a good thing, you should commend them. The same way you insult them when they do the other ones that we'll not talk about. But so I must commend Airpeace. On your flight to Gatwick, you offer jollof rice that actually tastes like jollof rice.
Thank you.
And they also offer pepper soup. So I think it's important to appreciate that. So thank you for that.
You're
yes,
welcome.
so pepper soup.
So I encourage you to fly on us to London Gatwick.
Okay. All right. Thank you, sir. So I will still circle back for a follow-up question, but let me ask you, Ma. I really like teachers a lot. I did not really like them when I was growing up because I was a very naughty student, but I am glad that I met teachers that were like, you must do well, whether you want to or not. So thank you so much for your hard work. I don't believe your reward is in heaven. I believe your reward should start from here. So thank you so much. So in terms of education and your sector, considering your experience there, I believe that like the faith-based organizations, you're also very close to the families.
Yes.
Through the children.
Absolutely.
So in terms of policy, how do you think, and I'm speaking practically now, how do you think at the education level your sector can drive policy changes for health and nutrition?
Okay, thank you. First, I'd like to thank Jesu Pelumi, who is the convener, and then, of course, the organizers. Thank you for having me here. I didn't think that this would come up, but she pushed and said I have to be here. Our meeting was just once. I met with her, and we had that chat when I went for my check, and she was so interested in me based on the things that I mentioned to her that I do. And of course, when my results came out, she also pointed out again that whenever she has the summit coming up, she would definitely want me to be one of the speakers. And I said, it's okay. All right, so going to education and then pushing policies for health and wellness for children. I think it starts from the space where you are. You can't push a policy that you're not practicing as such. So schools try as much as possible, and if I have to talk about that, I'll talk about what I'm doing. So we ensure that we have fora where we encourage parents to pack good food for their children, and then of course also talk to them about their own well-being. It takes you parents to be well and alive to also train the young ones coming. So as much as possible, we set programs within the school curriculum which we engage with parents oftentimes to encourage them for well-being. We have programs where we'll have to bring in nutritionists to talk to parents and let them see why they should embrace health and wellness. We also have to include the teachers as well. When they are not in a good state, obviously teaching can't take place. And of course, the learners are left on their own. So looking at the stakeholders who are the parents, the government, the children, and of course, we even the leaders, we push as much as possible to embed this in our curriculum to ensure that in the curriculum, programs, activities that gears towards wellness and health is included in our curriculum. Thank you.
Thank you so much for that, Ma. Let me start the follow-up questions from you. So in terms of outcomes to measure, I mean, there are different grades of education. You have the preschool, the nursery school, the primary school. So I'm speaking generally now because you meet them at different levels. So speaking generally, what are good outcomes in your opinion to measure in terms of the relationship between education and health at the different levels?
Okay, so recently, if you observe, we have awareness. In fact, talk about Guaranteed Trust Bank pushing on welfare. Welfare is not about you putting up their lunch bags with jollof rice, chicken, the ribena, and all of those things. What makes up those food? Because sometimes you see all that coming and you're asking, so what kind of food do you want to give them again? You can have that jollof rice packed from Monday to Friday. That's not healthy. And then you see them, children want to take more of carbs, more, because they love it and it's sweet for them to eat quickly. They want to take pizza, they want to take chocolate, they want to take the chocolates, they want to take, the confectionaries, cakes, and all of that. Now, as school owners, what we push for is pack healthy meals. Sometimes you have to even push to say, okay, within the week, we have a fruit day, which you have to say, okay, Fruity Wednesday or Fruity Friday. You say, oh, all water, no drinks, no fizzy drinks. Because when you engage with parents to let them know the reason, because you have to also communicate rightly to them to understand where you are coming from and why you have to push them. It starts with the space where you are. What are you pushing to them? Is it health? Is it health and wellness? Because when you see these children in class, their learning span is so short. It's so short because of the kind of food that they are fed with, and a whole lot of other things. As such, we have to now educate the parents about food. Sometimes you see that even schools have to go forward by saying, okay, we will start our own kitchen and also feed the children with the right food. Now, I'm not saying jollof rice is not good, but it shouldn't be that you have to take jollof rice from Monday through Friday. That's not a healthy thing. But you notice that children, once they open their meal, you've seen situations where children open their meal and they exclaim, oh my God, my mom is such a wicked soul. Why would she pack this for me? Or you see them, they're moody all through the day because what is in the meal? The meal might just be maybe beans and maybe carrots and all of that, and they just don't like the look of beans. So, but we keep pushing on things like this. Like, okay, parents, if you have to even pack beans, it's highly proteinous, and you know that such food, when it's in a high-tight container, it stinks when it's opened. So there are ways in which you can pack this and get better at it. So a lot of things that we push to parents. And then also from the side of the government, we have fora as well, where we are called. School owners are called to come to talk to them, what our experiences, can we share? So we share, and most times we are hopeful that some of the points, some of the salient points that we brought to bear would be implemented. And sometimes, you know, it may not be so much, but a few are picked, and then they keep pushing on them. Thank you.
Thank you. And, I started smiling because I attended a primary school where the headmistress banned anything that was not water. I'm not even joking. From the gates, they will check your lunch box. Anything that is not water, they will discard it. And for a long time, I could not drink Coke or any drink for a very long time because I wasn't used to it.
It's really helpful.
So I'm really impressed to hear about the fora where you're invited to share your stories and experiences. So thank you so much for sharing.
My pleasure.
Okay, let me ask you a second question, Mr. David. What role can airlines play in raising awareness about wellness and nutrition? Especially, for frequent flyers or even non-frequent flyers. And if there are examples that you're already working on, you can share them as well.
Okay. Again, beautiful. The airline has always been known for its forward thinking, and that's part of the reasons why when Pelumi approached us, we kind of like seized the opportunity to want to continue to stay as a pace setter within the aviation sector. I think one of such a thing is what you're currently doing, right? You are creating awareness, we're educating people, as to, some of the things that they can do when flying. For a lot of people, you might not know, but I want to say this today now. The aviation industry is one of the most regulated industry in the world, that everything you do, even a pin, if it drops on the floor, they can actually stop an aircraft, right, just to take care of it. So we're putting some of, good measures in place, one of which the plan is to encourage more of these wellness influencers, to give more education. We can support, the movement, the drive. Currently, we have what we call an in-flight magazine on our flights. We are promoting some of this information, to be carried out on those in-flight magazines, where passengers that are flying, of course, you have something to read, on the flight. For the IFE, which is the in-flight entertainment, it's something that we can also, look at. But of course, again, because it's regulated, you want to be sure what they're going to be aired. So it goes to the regulatory bodies, get an approval, so we can air things like the kind of exercise that we did here today. I have a friend that does that every morning. I'm always looking at her on her status like, oh my God, she started again. But doing it today now, believe you me, I sat down for like about five minutes and I was still trying to, get myself. It was really nice, right? So these are some of the things that we're looking at. On our frequent flyer program, even him, I don't know if he's still around, what we're trying to do is to partner with some fitness company whereby our loyal customers can also have access to all of these things because they're flying us on a regular basis. You can go to these, fitness centers and of course get some level of discount, right? That will encourage you if you know that, yeah, I'm paying next to nothing because I'm flying on this airline that's also creating awareness and driving wellness, basically, and mental health. So, yeah, basically we have that. I want to continue to improve on some of it.
Thank you so much. Thank you so much for that. So I have this funny dream in my head, and I'm going to put JP on the spot here because we also talked about it. She mentioned hers and I mentioned mine. So my weird dream is that one day, after the safety video comes up, you know, the video where the air hostesses are doing the choreography and all of that. Some of you don't pay attention, but pay attention. So my weird dream is that one day after that video, there's a short clip that follows that talks about health and wellness, that talks about exercise, that talks about food. So that's my weird dream. I will tell you JP's weird dream. So, and I'm saying this in the hope that after this, it will be something that will be implemented. Our weird dream is that one day when we enter airlines and we open the food box, we will not find processed flour, we will not find processed fruits, we will find real and natural products in those boxes. So thank you for that. Now, Commodore Ayuba, I strongly understand the influence that pulpit to homes. I say tiny, but the home is like the smallest unit of society. You get the home wrong, society is broken. So in terms of that influence and in our context for health and nutrition, what are practical ways that the pulpits can be in the forefront of ensuring that health and nutrition in the home is solid? Now, I mean, I understand that, you know, there's divine focus, but I also understand that if the body has an issue, it will be hard to focus on the divine. I know a couple of ministries do this, but I think we would be interested in seeing more so that it can translate and have a ripple effect. So, and if there are examples of scenarios already ongoing, please feel free to share. Thank you, sir.
Thank you very much. As you have earlier alluded to, know that along faith-based environments have different blocks, and that's CAN. You know, you have 5 blocks of CAN, each one with its own peculiar doctrine. But what the commonality among all the 5? One, we teach according to faith, Bible as main trust. And you know, when you talk about a miracle, Christ was able to feed the multitude. Just 2 pieces of fish, right, and 5 loaves of bread. That's talking nutrition from even within the Bible. What we do also is to look at areas in the Bible that talks about nutrition and importance, and going to the practical aspect of it. You know, we work with government a lot. Institution of palliatives. I don't really like using that word palliative. It's becoming a very nasty word. But we get relief, food relief. We get food contributions. We create our own food bank. Now we are able to reach out to the poorest of the poor, make sure that they are able to at least have one very good meal a day. For instance, in the nutrition program that we are running right now, we try to advocate that people to use it's not every time you have to have so much money to have nutritious meals. We try to indicate and that the kind of food that brings a lot of nutrition into the body, and that also varies from region to region. Fruits in season, for instance, the kind of food that you have in season, and some of them can even grow. Encourage them to grow within their garden system, you know. Like I try to do that. I try to, in my own garden, we had a lot of vegetables and fruits. Until the day I decided to add animals, goats to it. and they came and finished every vegetable in the garden. So we're still trying to resolve the difference now. We try to also say this, that it's not the volume. We try to educate. We actually have a directorate of education, youth and women. We all work together. We have a research directorate also. We are quite organized and actually work with UNICEF when it comes to issues of children, and so the benefits we get, we try to transfer. And this level of the words, like I said, the churches also grow a lot of, we have farms. Most churches have farms, and the products of the farm sometimes are shared almost freely to the have-nots mainly. And then those who have probably have to subsidize to those who do not have. This is an area where we work, and like you did say, the home is the smallest unit, the family, and everybody that comes from different homes, and then the church forms the larger society, and so we keep monitoring events like the issue of food security, now known as food insecurity, has made a lot of negative impact on people. Farmers can no longer farm. Sometimes they farm with soldiers all around them. In the northeast, for instance, you will find out that you cannot farm beyond 1 to 2 kilometers. I know of Borno, you dare not step out of 2 kilometers from the city center to farm. You either get killed or you get kidnapped. So it's that bad. So we all pray that things will improve, and we contribute to the aggregate effort to bring nutrition and health and well-being back into a normal society. I will be a willing volunteer to do this anytime I'm called upon. Anywhere I go to, count me as a very
Thank you so much, sir. Thank you so much. And we will take your word for it. I mean, thank you so much to our panelists. And if there's only one question, we'll take only one question. Okay, she's waving. Okay. All right, thank you so much. Everything that has been said here, we will put, and we would really pursue implementation. And when we do that, we will seek your support. So thank you so much for your time. You want to say something? Okay.
Sorry, I just wanted to say this, that the cake that was served and the refreshment was quite nutritious.
Yeah,
Only it was not heavy like 7 slices of yam.
It wasn't
but
cake.
It was very, very delicious and nutritious. Thank you.
Thank you so much, sir. Thank you, everyone. Please give our guests a round of applause as they... JP, please come and take pictures. Thank you, everyone, for listening.
Asabe, right, I'm sorry. The Yoruba in me Yorubalizes everything. I'm sorry. You are amazing. One more, please. Our moderator deserves a round of applause. Thank you. So please come together. Our convener, JP. You tried to hide, but you are a city that has been set on a hill, my dear. Thank you all so much. It was such... Please join as well, Asabe. Whoever you are, you have a role to play in ensuring healthy living.
Very interesting things with them to kind of encourage us to think outside of the box. So we'll head on to the next slide. Healthy, we cannot eat our local food and our local ingredients, but we have so much. These things are packed with so many nutrients, and if we cook them right, it can be very, very transformative. Sometimes we can limit our food to only a few things. Like, oh, ewedu has to be soup, right? Egusi has to be soup. Am I right? But why not something else? Let me not come and say some interesting things here today. There are many things we can do with our ingredients, with our spices. If we talk about some of our pepper soup spices, like the ehuru, the uda, the uziza seeds. Most of the times, alligator pepper, we use them in only pepper soup. But why can't we use them in our other meals? To replace the seasoning cubes, to add that lovely flavor to our various dishes. These things are our own, and they are very, very versatile. Our crops, from things like fonio to bambara groundnuts, they are very, very healthy, and these things can hold the key to food security. The question really is, how do we eat them and how do we cook them? Portion control is so important. We've spoken today about the fact that you don't have to eat 7 slices of yam to be full, right? And someone was saying that sometimes we feel vegetables are not filling. But when you eat enough vegetables, they are so high in fiber that you end up being fuller for longer. This picture, I think it was just here, on this side, it's a bread that we made with orange and purple flesh sweet potatoes. And this just shows the fact that if you're trying to reduce your processed things you're used to with these whole foods and whole ingredients. Something I wrote at the end of this slide is that fat is tasty but very high in calories. As Nigerians, we love our oil, right? We love frying our stew. We love that layer of oil on top, but we can still create amazing flavor with much, much less oil. On to the next slide, I'll talk a bit about the 80-20 rule. And that is really the fact that if you eat good, nutritious food, prepared healthily 80% of the time, you can splurge a bit the remaining 20%. But if you are keeping to a very healthy diet for that 80%, it makes all the difference. This is a fruit that is called horned melon or kiwano. It kind of tastes like a cucumber. It's locally grown, and we have such a wide variety of locally grown fruits and vegetables that are good for us. Even things like ogbono fruit. You know, the ogbono is bush mango, so the fruit even around that ogbono seed is extremely good for you. One of the keys is adaptation. If you're used to cooking your stew with 2 cooking spoons of oil, today you can try 1.5. Tomorrow you can try 1. If you're used to using 2 tablespoons of salt to boil your rice, you can make it 1.5 today. You can make it 1 tomorrow. By doing those small changes, you end up modifying your palate to desire less and less of these things like lots of oil and lots of salt. You have to be patient with yourself, but you also have to be consistent so that at the end of the day, you would have a much more balanced diet. We spoke a bit about knowing where your food comes from and also growing things at home, because that makes all the difference. On this slide right now, we have some spices. Anyone can identify what we have on the screen? Come again, sir? That's actually not, that first one. The one in the middle is actually Abakaliki rice. That's whole grain rice. The first one is fresh uziza seeds. The one at the end, we have, I don't know if I'm blocking it, a mix of spices. We have coriander, we have black pepper, white pepper, rosemary, and these are all things you can combine to make your own homemade spice blend. You can add the gingers, the garlic, the turmeric to give you a very nutritious and delicious meal at the end of the day. And I think one thing that really helps when we're talking about food security is also growing your own food. Just previously, we're talking about having a home garden, growing something as little as it might be. One thing it does to us is it also helps us appreciate the farmers for the amazing work that they are doing, and it brings us closer to our food. It might be the ewedu, the scent leaf, the curry leaf, no matter how small it is, the tomatoes, the peppers, it makes all the difference. And as I finish, I have a little gift for you. I have a QR code which you can scan, and then you're going to get access to some plant-based Nigerian recipes. Most of the time, we feel that for Nigerian food to be delicious, it has to be full of the meat and the chicken
we put in our mouth. There we have seasoning blends that I talked about. Made from 100% herbs, spices, vegetable to ensure that you have entire wholeness. So then I talked about that we launched our gluten-free flour. So we heard Chef Moyo talk about Acha Fonio. It's a super cereal. It's a super whole grain that is forgotten. For people that are in the north, it's just like a walk in the park. They eat it every day. But for us in the west, in the east, you know, we are still trying to introduce Acha and Fonio to them. And we see that even the people out there know more of the product than we that are in here. And we've been in talks with the World Food Program, UNICEF, to be able to adopt Acha into the school feeding program. So, like I said, I'm excited. You can always come to the stand or visit our website to see the range of product that we have. And another product that, you know, is gradually creeping into the market is OFSP. OFSP is orange flesh sweet potato. So we know our normal sweet potato that we eat, but this is orange flesh. And the government, we are trying to certify the purple flesh also. So the orange flesh sweet potato has a nutrient called beta-carotene. It's the nutrient that you see in palm oil. So that's what it has. And it also is already biofortified with vitamin A. At the just concluded trade fair, we introduced it, and it actually sold that. We use it to make chin-chin. It's sweet already. So when people ate it, they were like, oh, it's sugary. Did you add sugar? The sweet potato is already sweet, so you don't need to add actually sugar. So we use it to bake chin-chin. We use it to bake bread. So we're trying to ensure that people leave white flour and adopt this gluten-free flour. So we have different flours that Chef Moyo talked about. We have sorghum flour, very, very nutritious. For people that do yogurt, you know, parfait, instead of using sesame seed, you can actually use millet. Millet, wash it, you know, soak it, wash it, and dry it, and use it for the parfait. Perfect. So, thank you very much.
Thank you so much. If you're looking forward to seeing our products, they're back. We have our next vendor.
All right, thank you very much. Good afternoon, everybody. Taiwo, actually, I represent TDK Nigeria Limited. We are proud sponsors of TDK Zobo. Oh, okay. Thank you. So that's our product, TDK Zobo. Thank you to JP for giving us this opportunity to come for this nutrition program, and it's been a wonderful time. Thank you very much. So we have this product in different variants. We have the 50 cl, we have the children pack, we have the 35 cl, we also make the 5-liter bottles, and we also go for parties. Perhaps you want us to brand this for your party, we do that. Perhaps you want us to come and have a stand at your party, we do that. And this Zobo is 100% natural. We have pineapple in it, we have cucumbers, and we have apple in it. Now, our factory is located at Ikorodu, where we have our machines that produce this Zobo. So we put everything in the machine process, then we juice it out and have it bottled. So if you're looking to check out our product, we have it on TikTok, we have it on Instagram at TDK Zobo. On this bottle, every detail you need is on this bottle. Thank you very much.
Thank you very much. With that video alone, there's no how you cannot have social media. You need it because in fact, I don't need to say anything. Their stand is at the back. Make sure to go check out TDK. And yeah, I know that I'm going to finish my money at that baksha with the Zobo, with the spices. I envision a lightness in my wallet.
Sorry, I forgot to say, this is NAFDAC approved and is MANCAP approved. Thank you.
at this point, I think I should just wrap up because what else is left to say? All right. Once again, thank you all so much. Today has been absolutely amazing. I'm sure we did not envision it being this great. From the healthcare panel to the tech panel to the policies panel, the exercise, our speakers, even you all that have been here, to every single person who joined us online virtually, we say thank you. To every single person, to every speaker who couldn't be here but ensured that they joined us virtually, we say thank you. We see you, we love you, and we appreciate you. Now, of course, I don't think it will be right for the event to end and the convener will not hold this mic to address us. Don't you think so? Exactly. So, ladies and gentlemen, for the closing address, the lady with a vision who brought us all here and ensured that we're going home not the same way. We're going home more enlightened, more informed, more knowledgeable. The convener of Africa's Nutrition and Health Summit, Dr. Jesukpelumi Adenihu.
Thank you so much. Okay, so no, before we take our seats, because I was actually going to ask us to all stand up. I mean, in the spirit of ensuring that we are active, and we've been here since morning. I don't think people would typically do that in learning about their health. So I want us to all graciously stand up and then give a beautiful applause to ourselves. If at all anything, I think we are actually the real MVPs. I'm echoing a lot though. So we're the real MVPs, and I want to commend us, right, for believing in this vision and for even believing that we had tangible things to communicate with us here today. And how many of us can attest to the impact that it has had on us so far? Excellent. All right, so please take your seats like the kings and queens of Africa that you are. All right, thank you. So I'll just be, reading my appreciation. Typically, I'll do it from my heart, but just so that I don't get so emotional, let me just read something that has been written. And I know that before anything is birthed, there's a lot that goes into it, but I definitely did not do this alone. See 30 years. I want to be able to see people like, Victor. I want to see Tito. I want to see them saying that, oh, yes, whatever it is that we've preached or that we've taught people, like it has had tremendous impact and tremendous influence. That's the goal for us. So again, it is a movement and we should, be on the lookout. So yes, I would first like to give thanks to God, the author and the perfecter of all things, whose grace has been the foundation of this summit, and his wisdom, his strength has guided every step of this journey. So I'll just say a quick story, right? And maybe just to encourage someone, just a very brief one. So I think 2 days ago, I was still contemplating whether this summit was going to happen, but I'm glad it did, right? So there are times that there are balls that are thrown at you and you're like, oh God, who asked me to come on this journey? Like, who actually sent me? But I mean, every challenge is actually a stepping stone to greater things. So yes, I'm thankful to God for the strength. I'm thankful for my parents. So Mommy, please, I'm trying to get emotional. So I was talking to some people outside and said, oh, I see where you get your flair from or where you get your doggedness. And I said, lion no dey born goods. Right? So I'm thankful for my parents, for being ever supportive, and for always standing with me, for me, and by me. I'm thankful for their unwavering belief and even for the values that they've instilled in me as an individual. They've shaped my vision, my purpose, and my parents are teachers, so they're my first teachers and my lifelong inspiration. Sorry, please. Okay, so, I mean, moving forward, like something that I would really see that ANHS does is the promotion of family, right? The family will be at the core of what it is that we are trying to influence. So family health, family nutrition, and then across the sectors, so even in the workplaces, but in different places. And then, of course, to my core team, I mean, I disturbed a lot of them. So I don't think the partners got enough disturbance as much as I did to my core team members. But I would say that they are really the engine of this summit. It's one thing to have an idea. It's one thing to have a vision. All right, thank you. So, and also it's another thing to have people go on the journey with you. So I'd like to thank each and every member of the core team, and I'd like to say, yes, we've set the pace for change, and I could not have asked for a better team to go on this journey with me. So please celebrate every one of them. They're here, they're in different countries. We have a core team member in Israel doing a PhD in agriculture. We have people in the northern state, in Kaduna, in Lagos. Yes, so, I mean, it really is a pan-African. I'd also like to thank the volunteers. Please, can we really celebrate them? I mean, put life even to this very experience that we've had. Now to our partners. Your support has been instrumental. Thank you for coming on board. Thank you for believing that together we can really have an impactful summit. To every stakeholder, whether you came as a speaker, a panelist, a participant, supporter, from afar, from here, I really want to say thank you for believing in us, and I am confident that every conversation that we've had here will bear fruits of health, wellness, and prosperity for Africa and beyond. So they'll say this quote that if you want to go far or fast, you go alone, but if you want to go far, you do it together. And today I stand proud and humbled to say that we've gone far together, every single person here. So again, as I leave, I want us to remember that this is only the beginning. And someone had started by saying, that was Prof. Oshinubi, he did mention how before you have a forest, right, you have a tree. So this is a seed that we're laying today, and I believe that this seed will evolve into a root, it will evolve into a tree, and then a forest that would also birth greater solutions for this continent. So again, I would like to say thank you for coming together. And I am happy and even really excited at the level of knowledge and even the accuracy of the communications that we've experienced today. I trust that we would all be ambassadors of better lives and healthier living, and that we also would see ourselves as stakeholders of Africa's Nutrition Health Summit, being members or being participants of the inaugural edition. So on this note, I'd like to say thank you all for coming, and I do wish us a beautiful evening and even a healthier year ahead. And just to mention, so that we know that this is a marathon, so definitely we will be hearing from us the actionable and the implementable steps that we'll be taking, and even the further engagements that we'll be having with the stakeholders. But yes, we can look forward to 2025 and be on the lookout for the next edition of this beautiful summit. So again, thank you so much, everyone. It's been a pleasure having us here, and it's been a beautiful time together. Thank you.
One more time, Dr. JP deserves a round of applause. I'm very proud of you, JP. You're amazing. You are such a visionary. Well done. All right, and on that note, I want to believe we have come to the end of the inaugural edition of Africa's Nutrition and Health Summit 2024. The theme, Soil to Wellness, Shaping a Unified Approach to Africa's Health. I believe that we have done justice to this theme. Thank you all so much for being here, for indulging us, spending your time with us. My name is Pelumi Buari. It's been an honor and a privilege to be your host. And don't worry, it's not Buhari, it's Buari Ejo. Emma Shekwe from Ejo. Eshe, God bless you. And on that note, thank you all so much. God bless you, and see you next year.